and welcome to the August 3rd, 2021 Lane County Board of Commissioner meetings. We will move right to item 1, adjustments to the agenda. Are there any? Seeing none. Item number 2, Mr. Mokrohysky, Commissioners, is there any emergency business? Seeing none. We are now at the public comment section in our agenda. To the public watching this meeting, when you registered to watch in this temporary virtual format, you were registered in our system as attendees. Attendees are webinar participants who are audience members viewing the meeting. Your microphone and your webcam are automatically muted as attendees. Now, however, we're opening the meeting for public comment. If you wish to participate in public comment, please raise your virtual hand to be recognized by pressing the hand icon. When public comment begins, our meeting organizer, Diana Jones, will call names. When your name is called, you will be unmuted and given 3 minutes for public comment. When your 3 minutes are up, the chair will let you know. I guess that would be me. And you will be returned to your muted status, and the next name will be called. You can then continue to watch the webinar as long as you choose, and we will try to give everyone who wishes to present public comment an opportunity to do so. And Diana, do we have at this time anyone that would like to make public comment to the board?
Thank you, Chair Bernie. At this time, I do see some hands raised. Please only press your virtual hand button once because it is a toggle. So if you press it twice, it'll take your hand back down and I won't know to call upon you. I'm going to just make a quick comment to Ronald Stitka. I do see your hand is up, but you have not entered your PIN. So until you do that, I won't be able to call upon you to give public comment. And I just also sent it to you again. With that, I will begin with Harry Sanger. I will unmute your microphone and begin the timer, and we will be followed by Andrew Black. Mr. Sanger, I show you are self-muted.
Thank you.
There you go.
So, County Commissioners, thank you for having me today. As you well know, Lane County is a home rule county. Maybe you've heard the governor's most recent edict upon early childhood education and agree, and maybe you don't. I look around our community and see much the same. Many folks chose not to wear a mask after the state mandates eased up, while I still see a few concerned citizens who choose to wear a mask in public. It's a simple, right? Choice. We all make choices every day. You were elected because we trust the choices you make for our community. You're also elected to help lead our local sovereign unit of government, the county. Lane County has traditionally enjoyed the freedom of home rule, withholding power at the local level, empowering our neighbors who we trust to have our backs. Now the state is trying to take our local control and mandate actions based on politics and not science. Salem seems to believe that they can run Lane County better than Lane County can. I'm here today to ask you to take a stand for our children. You have the power to rebuke Kate Brown and her attack on local control. The local school boards are looking to Lane County Public Health for guidance. If the state refuses to acknowledge science, we hope that you will look at the facts. Less children have died from COVID in a year and a half than in the average flu season. Schools were shut down for a year with no scientific basis other than to ostensibly protect the adult staff. This was the reason teachers and staff jumped above our most vulnerable citizens, the elderly, when vaccines became available. Now, everyone who is vulnerable to serious illness from COVID has had the opportunity to vaccinate. I'm here today to ask Lane County to follow the science and use the power of our local public health agency to support fully open schools with no mandatory masks or vaccines, no quarantines, and no more broken dreams. We need our children to feel normal, not afraid. We need our children to embrace their peers, not their fear. Children can't learn muffled lessons from half-faced teachers. Deaf children are left on the sidelines. Speech impediments aren't improving. We need to see and hear clearly. We need to return to normal. We were told the virus took normal away, but it wasn't the virus. It was bureaucrats and irresponsible, fear-driven media narratives that put us at dis-ease. This is not to say we should be irresponsible ourselves. The solutions are simple. Wash your hands frequently, stay home if you're sick, follow good hygiene. And please stop living in irrational fear. Thank you.
Thank you for your public comment. I will now unmute Andrew Black and reset the timer. And Andrew Black will be followed by Ronald Stitka.
Yes, good morning. Thank you for having this public comment period and allowing me to speak today. Thank you, Harry, for those eloquent words. I really appreciate that. My comment today is similar. We've been fighting for our right to have our child go to school without a mask in the fall. We were supposed to have a school board meeting tomorrow where ostensibly the school board would hear our opinions either for mask mandates or against mask mandates in school. And yet the governor decided with a stroke of a pen that there would be no debate and that Oregon schools would have to be masked up for the fall. My questions: when will this end? There's no deadline date for masking our children. And there's flimsy science showing that it's even very, worthwhile or effective for children. So we're really concerned about it. Sending our school children to, for 5 to 7 hours a day in a mask does not seem like a good idea. That mask starts out clean and ends up dirty, very dirty by the end of the day. I mean, there's a physical health concern. There's our mental health concerns for our students and children who are basically being asked to cover their beautiful faces. I mean, if you think that that doesn't affect the environment in the school, if you think that it doesn't lead to isolation and an inability to make friends, you're wrong. Okay, I have a child. I know. Maybe you do too. So I'm really frustrated about this. So frustrated that I'm going to unenroll my child in homeschool. And I also want to encourage you guys to speak out against this, or at least discuss it. It doesn't make any sense to me. The other thing is, I just read in the newspaper today that New York City is going to be requiring proof of vaccination for entering restaurants, gyms, theaters, et cetera, et cetera. I spoke about this a couple weeks ago at a board meeting. I really encourage you to come out strongly against vaccine passports. This looks like it's could become a reality in America. There's a lot of people that are vaccinated in Lane County, but there's also like 155,000 that aren't. And I think these vaccine passports are a slippery slope to authoritarianism. And the writing's on the wall. The signs are here. Just watch the news and hear what people have to say about the unvaccinated. They're trying to make unvaccinated out to be unclean, unfit to be in society. You guys can be leaders and step up and denounce this type of behavior. We all know where this leads. So I encourage you to speak out against these vaccine passports as well. Thank you.
Thank you for your public comment. Our next presenter is Ronald Stitka, followed by Eileen Herman. Ronald, I will unmute your microphone and begin the timer.
Thank you. Good morning, Commissioners. My name is Ron Stitka. I'm speaking primarily as chair of the Lane PTSD Task Force, which is a grassroots organization formed in 2019. I'm going to do this by virtue of an open letter, but I'll send hard copies to you as well as the report that's been filed, which should already be in your boxes. Dear Commissioners, first I want to thank each of you for your dedication and public service. I'm a veteran retiring in 2002, a 30-year service as a judge advocate and a military judge in the United States Air Force. I'm also a musician. I have been an instructor for Guitars for Vets, a national foundation, and I taught ukulele and guitar courses at Jasper Mountain Safe Center for 3 years until that work was suspended by COVID restrictions. I'm also president of the Eugene Gleben. I believe music is more than just entertainment. It can be a mental health tool. I have presented each of you with 3 informational items about PTSD and trauma-informed care. The first and primary one is the Lane PTSD Task Force report with findings and recommendations for local, state, and federal leaders. The genesis of that effort started with the Moving Wall Project in 2016 to honor fallen veterans of the Vietnam conflict and their families and comrades who survived. This effort brought me into contact with Commissioner Farr, State Senator James Manning, and a number of veterans with PTSD diagnoses. This was the start of my effort to do something meaningful for these brave men and women. My daughter, Kim, a former juvenile probation officer in Oklahoma City, led me on a path toward poor parenting and bad environmental factors, which put children on the path to what develops into PTSD. Child abuse and neglect seem to be commonly associated with the onset of PTSD when traumatic events occur, and that's a common factor with veterans as well. The PTSD report discusses the importance of prevention, preparation, and implementing better methods and long-term programs for mental health care. In the short term, it implement desensitization techniques, but try to shift longer term to resensitization techniques through neuroplasticity using music and art training and creative processes to rewire the brain and the mind to a healthier state. Now, this is absent in current mental health care in this particular field. We need to start early. The second document, the ASK Ask Declaration, sets out the importance of music and arts for full brain development from a young age. Trauma will occur, and we need to prepare ourselves and our youth in particular to deal with it. And finally, I have provided each of you with a link to the 4th Annual PTSD Symposium held on June 26th for a replay of very qualified speakers addressing 3 areas of homelessness, including segments for veterans and youth, on what we can and should be doing in Lane County as a community to rectify the needs for better mental health care. Each of you are encouraged to review these as a service we have provided to aid you in your important work. Thank you.
Thank you.
Thank you for your public comment. I will now unmute Eileen Herman. Eileen, you will be followed by Nicole DeGraff. Eileen, I show you're self-muted. Eileen, I'm not sure if you can hear me, but you are self-muted. We can't hear you. Okay, I'm gonna move to Nicole DeGraff, and we'll return to Eileen after that. So Nicole, I will unmute your microphone and I will begin the timer. Nicole, I show you are self-muted as well. There you go.
Okay. Good morning. Thank you for taking my public comment. I was going to read from a prepared statement, but I heard another commenter, Andrew Black, and I wanted to let you guys know I've unenrolled my 3 children, and I'm homeschooling them. And let me tell you, it's not as hard as people think, but it is challenging. I have a 14-year-old, a 13-year-old, and an 8-year-old. And I'm just going to speak from the heart right now. Sorry if you can hear some noise. I'm sitting out on my patio because I love Oregon summer mornings outside. And this is not to impugn Commissioner Trigger, but I saw a post that you said that you're wearing your mask again and that it's not hard to do. And I just wanted to tell you what it's like to have a child with selective mutism, autism, and OCD. My daughter has not worn a mask this entire time, nor would I try to push that on her because she's afraid of everything, and I don't need to get personal details because I don't feel like I need to explain everything. But let me tell you, it is not that easy for people to do. We limited places we went, not because we were afraid of a virus, because we all got sick January 2020. We are more afraid of the development. She doesn't like people to see her smile. She doesn't talk to people. Somebody with a disability cannot just simply learn to put a mask on and then not have their development affected. Before people, especially elected officials, say, oh, it's not hard to do, you need to think about your privilege and how there are other people in this world trying to navigate this difficult time. And it is not so easy. And if you think that we should just send our kids to school with masks, you think we would rather homeschool our kids than get them the socialization. And man, that was funny. The socialization and, learning. Two of my kids are on IEPs. I would love for them to go to school the way I grew up going to school, but it was not good for my kid's development to do that. She doesn't even go to the bathroom at school. I mean, we have so many different things we're dealing with. A mask is, it really is a barrier. Many kids cannot wear those masks. My son has asthma. He struggles to get lightheaded. So we're not just being difficult when we say we're unenrolling our kids. We have strong reasons behind that. And I just want to say that if you thought about doing mask mandates in Lane County, I know Dr. Ledke had said he was drafting a framework. That's a really bad idea because people will limit where they go and they will spend their money in other counties, and it will negatively impact Main Street even further. And so I just want you to think about that. And I also had a question about River Avenue. I thought that had been bought with COVID funds, so I was curious as to where those funds would go once you sold that. Thank you.
Thank you for your public comment. Our next speaker is Eileen Herman. Eileen, I will try to unmute your microphone again and begin the timer for you. I still show you are self-muted. We're still not seeing you. At this time, Eileen is our last presenter. If anyone else is on the line that would like to give public comment, please raise your hand now, and we'll give Eileen a moment to unmute. I don't see any other hands raised. Eileen, I do see your comment about asking where your unmute button is, and unfortunately, I don't know your device, so I can't answer that question. Kelly, I do see another person has raised their hand, Kelly Kane. I will unmute your microphone, and Eileen will come back to you one more time after this. Kelly,
Hi,
you may begin your public comment.
Oh, thank you. Good morning, everyone. I wanted to just voice my opinion. I'm deeply concerned that we're returning back to mask rules based on a recommendation from the CDC because of concerns over the Delta variant. And I was wondering if you knew if it was true that the changes ordered by Governor Brown to the Ready School Safe Learners framework that will now mandate masks are based on 23 COVID cases over a 2-week period. We know that the RT-PCR test positivity should not be taken as an accurate measure of infectious SARS-CoV-2 incidence. Masks are not a benign intervention, and their effects are clinically relevant. And I just ask that you guys consider this and do what's best for our community. We were told back in June that decisions about COVID measures would be made at the local level. And again, at the flip of a switch, that was changed. I want to have more information about why. I want to have more information about the data that was used to make this decision. I think that should be transparent and publicly available. And I thank you for my comment. That's all.
Diana, are you able to have Eileen Herman speak to us yet?
Oh, sorry. I've been talking and my phone was on mute. Sorry. Eileen, I still show yourself muted. I sent you a private note as well. So I don't know what else to do other than move forward with the meeting, if you agree with that, Chair. I don't see any other hands raised. Okay, at this time, I will turn the meeting back over to you.
Ms. Herman, I'm so sorry that technology precluded you providing public testimony. And I thank everyone that did. This is the opportunity for commissioners now after public testimony to respond to public comments or other issues and remonstrances. Would any commissioners like to begin? Yes, Commissioner Bozovich.
Thank you. First, I want to thank everybody for their public comment. And Eileen, I'm sorry you couldn't unmute yourself. Please send us an email with your public comment to the board, and we'll read that. We get lots of email public comment also that we all read. Yeah, I real quickly, just to address the issue of mask mandates and local control, I fully support that. I too am concerned, and when we get to our COVID update later, I think I'll be asking some questions of the county administrator about disconnect from CDC policy.
Commissioner
That's not from my mic. If it was a dog barking, it might be me. But even with the increase in cases, we are seeing the same level of hospitalization and deaths that we saw in June when we lifted COVID restrictions. So the vaccine appears to be doing its job, and readily available and free to all of our communities. So I have some questions about extending some of these mandates locally. We'll address that later. I do want to spend a minute addressing something very serious that happened in my district a while ago that I haven't commented on because there was an active criminal investigation ongoing, which has reached a conclusion with the arrest of a 19-year-old man. A home in the Santa Clara neighborhood was vandalized with paintballs, and there is somebody of a minority status living in that home, and it was thought to be an attack, particularly on that person's race. It appears that wasn't the case, that the person that perpetrated this didn't know who lived there. It was about the yard signs at the home, which is just as bad because the yard signs were Black Lives Matter yard signs. This is a symptom of something that's been going on in our country for a while, where it seems like it's become okay to respond with violence and intimidation to silence speech. We saw it when the owner of Elkhorn Brewery spoke out, and then his business was targeted by a group of rioters. And we've seen it other places. It's something we just should not tolerate. There shouldn't, and particularly in this case, there's an element of racism involved, and that shouldn't be tolerated. Speech does not harm anyone and should be left to be addressed with speech. If you disagree with speech, speak out. Make your public argument. Let people decide from public discourse. Acting out intimidation and violence are wrong, always, no matter what side it is. So I just want to say I have no tolerance of the actions in Santa Clara. I have no tolerance in the actions against Elkhorn Brewery. I spoke out about that before. I have no tolerance when somebody tries to use any form of intimidation and violence because of somebody's speech. So I just wanted to get that out there now that criminal investigations reach conclusion, and I don't feel like I'm going to be interfering with that investigation. So I just want to say, please, we have to stop this cycle that is so anti-American, so anti-democratic principles of attacking people over what they say and what they believe.
Thank you, Commissioner. Commissioner Bozovich, I didn't interrupt, did I? Okay, thank you. Are any other commissioners? Yes, Commissioner Buck.
Thank you, Chair. I too appreciate everybody that's spoken today. We've had a lot happen in our county since we last met. We've had a shooting at the fair. We've lost a Deputy Couch. We've had big fires now going on in my East Lane district with the Middle Fork complex fires, and more even southern than those. We've had the retirement of Carrie Carver. There's a lot going on in our county every single day, and it is really important that we hear from people. I think we've heard from a couple of folks we've never heard from before. So I do appreciate those people coming in. But we have a lot to discuss today. I just at least wanted to remind everybody of how much we're all going through. And each one is a whole conversation within itself that hopefully we'll discuss a little bit more today. Thank you, Chair.
Thank you very much, Commissioner. Any other commissioner remonstrances? Oh, yes, Vice Chair Farr.
Thank you, Chair Bernie. And just a very quick note to Commissioner Buck. Well stated. A lot has happened since the last time we met, including, as you mentioned, the tragedy involving Deputy Couch, as Deputy Couch was attempting heroics, rescuing someone else, drowned herself. And our heart goes out to her family. Our heart goes out to the department and to the people who knew Deputy Couch. It's absolutely heartbreaking. Thank you for bringing that up, Commissioner Buck. And regarding Deputy Carver's retirement, what a wonderful career Deputy Carver has had with Lane County. Raised Deputy Carver on a pedestal now and for always. What an amazing individual she has been. And we will all stay in touch as much as we possibly can with Deputy Carver. A couple of things. Commissioner Bozovich talked about the paintballing incident. It was horrendous. I've seen the video of it, and the car drove slowly by and absolutely singled out this one residence, among many others that had in the neighborhood. I drove through the neighborhood, and there were other Black Lives Matter signs, but this house was particularly targeted. And I think I'm looking forward to further discussion, further investigation to see exactly why that house was targeted. And evidently, it has been a repeat incident, or a repeat series of incidents at that house. So I spent a little bit of time speaking with the two residents and heard some input from them. So look forward to seeing how this moves forward. It is a big deal. It is a huge deal that this happened, and it is it's just indicative of the types of abuse that people in our community suffer, in some part because of speech, in some part because of the way they look, and in some part because of what they believe. And it really is intolerable. This is a big deal. We need to make certain that this is a big deal. I will continue to pay very, very close attention as we move forward with this particular incident as it relates to other incidents in our community. The last thing that I would like to talk about is an opportunity I had this week to travel upstream the Mackenzie. And I talked to Commissioner Buck about this prior to my going, and then after I went up there, I had a chance to meet with people up the Mackenzie who are in varying stages of use of tiny homes. Now we all talk about tiny homes. We all talk about how do we facilitate the use of tiny homes in this what is a golden opportunity to demonstrate that tiny homes can be a valuable part of our of what we allow on in housing, not only in the fire zone, but in throughout the rest of Lane County, to be an example of how we can best get people in housing that is dignified, that works for them for the temporary period, or even into a longer term period. I spoke with people who were who actually had their homes destroyed in the fire, people in the process of planning homes in what is a fire zone, and people who were in the path of the fire. So it's interesting to know that all of the people had a very, very similar comment, a very, very similar discussion about how our planning department, which we all praise and we all cheer, our planning department permitting had reasons to slow down the process to allow them moving into their tiny homes. I'm not going to go into the details of that right now, but I have some very direct quotes about this. And later in this meeting, when we get to the agenda team items, I will talk about an item regarding tiny homes in the holiday fire zone and the path of the holiday fire zone, because we do have an opportunity to adjust rules, to temporarily suspend rules, and to make certain that we have that people can live in these homes, which are very dignified, very affordable, very usable, and can allow for a whole lot of different reasons for people to live in them, whether they're waiting to build a permanent home, whether it can be their home for the rest of their life, or whether it can be just a step into being able to afford to rebuild their home. So, and Commissioner Buck, you know that some folks in that area, I mean, there's so many different situations. Some people did not have insurance. Some people didn't have a building on their land. They were planning building. And some people, their homes were raised and they're just trying to wait until the next opportunity to build. So there are a lot of discussions that need to go on around that. But the most important thing to me is something that I talk about very, very often. How can we facilitate the use of small homes, whether mobile or on foundations, to let people move as quickly as possible into housing that will be very adequate, more than adequate for their needs. So I'll talk about that later as we get to the agenda setting.
Thank you, Commissioner. Yes, Commissioner Trieger.
Thank you, Chair. In the interest of time, I'll be brief. I want to very much appreciate everyone who spoke. As Commissioner Bozievich said, your speech is your right, and I appreciate folks coming to talk to us, whether I agree with their statements or not. Quite specifically regarding masking and children, I think if all of us for whom it is easy to mask, which is the vast majority of us, would do so, we would get on the other side of this Delta variant quickly, the way the vaccines would have gotten us on the other side of COVID-19 had it not been for this variant. And in fact, those of us for whom masking is relatively easy do it for the sake of those for whom it is not possible. I also want to say that I appreciate Commissioner Bozievich's comments, but I do want to say that speech can harm. There is such a thing as hate speech. I think it's important to point that out. But again, it is exactly all of our rights to speak up. And when speech is the issue that we're taking objection with, responding with speech rather than acts of violence and intimidation is absolutely the right path. Finally, I want to appreciate Commissioner Buck's comments and just amplify the comment about the incident at the fair. I was at the fair the next day, met with staff, got a tour, did a volunteer shift in a booth of one of our local organizations. And I think about our county administrator always reminding us not to waste a good crisis. And my comments, or excuse me, my conversation with staff really pointed out for me that there's a lot more we could be doing at our fairgrounds when we have large mass public events to improve and increase safety for everyone, staff, volunteers, vendors, and attendees. And some of these revolve very specifically around the incident with a gun discharging, but some are broader. So I think this is a real opportunity for us to learn and think about what kinds of policies and practices and investments we could be making to ensure better safety in a number of circumstances at that location. And as your liaison and representative to the Fair Board, I'm looking forward to our Fair Board meeting this week to talk with that group specifically about the Lane County Fair and what we could be doing to improve safety for a number of potential incidents that we might experience at that event. Other than that unfortunate and troubling incident, it was one of our most successful fairs and people were having a great time in spite of the heat. And so I just want to call that out and let folks who might be listening know that I'm paying attention and I'm deeply concerned about what happened. And finally, my greatest concern about what happened is that we have youth in our community who feel so disenfranchised and have so much to lose that they would do such a thing as bring a gun into a fair. That is deeply troubling and concerning to me. Thank you, Chair.
Thank you very much, Commissioner. Are there any other commissioner Are there any other commissioner remonstrances at this time? Commissioner Trieger, didn't you just finish your remonstrance?
I did. I'm sorry, Chair. Just as a collegial heads up, I will have 2 items later in assignments. Thank you. That I'll be seeking head nods for. Thank you so much.
Thank you. All I would like to say is, and forgive me if I pronounce any of these names incorrectly, but Mr. Samger, Mr. Black, Mr. Sitka, Ms. DeGrath, Ms. Kane, and hopefully via writing, Ms. Herman. I want to thank you, as other commissioners have, for engaging in your and our and everyone's democratic right to speak your mind, provide your input to your representatives. You know, in so many ways, and this doesn't directly address items you mentioned, but they impact all of us. Most of us have children and grandchildren or grandchildren. This is so personal. In many ways, this feels like what Churchill wrote. This feels like the best of times and the worst of times. In my community, I am seeing so many acts of heroism, so many people helping others in need, so many businesses rallying as best they can around community needs. And I'm also seeing an amping up of frustration. So all I can do is request that we all listen to everyone's input, as we did with presenters today, and appreciated it, and find those areas of common ground that we can work on. And when we don't have common ground, agree to disagree civilly and elevate the quality of the discussion towards solutions for all of us. So really, truly, I know that's a 60,000-foot level, but that's the feelings that came from me as I was listening to the input and to commissioners' remonstrances. So thank you very much. We now move to item 5 on our agenda, county administration. I think we're very interested in this. This is the COVID-19 response and recovery report that we get from Mr. Adams and Mr. Mokraheisky, whenever the two of you are ready.
Thank you, Chair. And I could just maybe start with this. Sorry, I was just got a call from the head of Peace Health about some issues. And so Mr. Adams will have some information here today. I know you received a lot of public comment this morning. I want to just clarify for the board and the public that are watching that we are not, certainly staff is not at this stage recommending a community mask mandate to the board, nor a vaccination mandate at this stage. It's not my understanding that the board is considering that. So I certainly understand that there's been a lot of discussion at the federal and state levels and in the community, and oftentimes our local elected bodies become the forum with which people express their opinions, and that's a good thing. It's part of our democracy to hear that feedback, but I just want to provide that clarity that we are not currently recommending to the board that you institute a mask or a community mask or vaccination requirement. With that said, we do have, many public health officials are arguing that we are entering maybe not even a new phase of this pandemic, but a new pandemic altogether with the Delta variant. And so it is a serious thing for us to be considering. And we have instituted some adjustments to our practices and policies within Lane County as an employer. Happy to answer questions about that, but I want to just turn it over to Mr. Adams to provide you with an update on the state of disease in our community.
Thank you, Steve. Good morning, Chair Bernie, commissioners. Thank you for the opportunity to bring you up to speed. I'm just pulling my screen up for you. Okay, and so we begin with the EPI curve. I have, in weeks previous, zoomed in and out to really give you finer level detail on where we are with respect to the state of disease in here in Lane County. And you'll notice I have pulled all the way back out from the onset to give you a sense of the magnitude of the Delta spike that has begun to really manifest in the latter half of July and has accelerated even within the last week here in Lane County. This plot was calculated with yesterday morning's data pool. We pull our data at 8 a.m. each morning to begin our case investigation and contact tracing processes. The latest data from this morning's data pool at 8 a.m., 15,308 cases. That's an increase of 135 cases in the past 24 hours. Those we are tracking as infectious in the community is an increase of 60 in the last 24 hours. That's 564. We now have 24 Wayne County residents in hospital, 5 of whom are in ICU beds. And we are holding firm at 175 deaths. We have not had a death reported since late last week. I want to show you a little bit of a different take on the data. So those were just gross cases, and scaling these now to cases per 100,000. This gives, it's essentially the same data, but just repackaged, and is a shorter period of time that shows the cases in context, making them comparable from one jurisdiction to the next. And moving then to, in this 7-day moving average, I have shown in many of the weekly updates for the board the OHA risk guidance that would characterize the state of disease within the counties of Oregon in a high, low, medium scenario. So with the conclusion of the governor's executive orders at the end of June, and the kind of stand in for now pushing forward CDC recommendations, we're moving now to this 7-day moving average is what CDC uses, same as we do. So we're not looking specifically at a 2-week moving average as OHA did. We're using a 7-day moving average. So last week obviously was quite eventful. We heard specifically from CDC that we should return to masking in indoor social settings for all individuals, regardless of vaccination status, in counties that are characterized as having its substantial or high transmission. This is the latest data poll from CDC for their last week of moving average. Last week, Wayne County was showing up in the substantial range, and for that metric, it's 50 cases per 100,000, and high. Now we moved with the change of the week into high transmission, and the threshold there is 100 cases per 100,000. Specifically, OHA and the governor followed suit after the CDC masking change, and OHA has made the specific recommendation out to all Oregonians to begin masking indoors in social settings, regardless of vaccination status. So, as we have seen a rapid increase in hospitalizations as the kind of lagging indicator of the rapid ramp up in cases. Specifically, I wanted to give you a snapshot of where we stand with respect to vaccination or to our hospital status. You will recall during the UK variant bump that we experienced back in April that the governor was noting 300 COVID patients in hospital as being a level of concern. And she at that time put counties into extreme risk and instituted measures. So we have now exceeded that statewide. As of mid-afternoon yesterday, we had 312 in hospital. And I wanted to begin to flag some of what we noted yesterday in touch with our hospital partners. So I'm reporting, as of yesterday, I was reporting 21 Lane County residents in hospital. And we did a little bit of a deeper dive. 2 of those individuals were in hospital outside of Lane County. 19 of the 21 were in hospital here in Lane County in one of our local hospitals. However, in touching base with our hospital partners and in consulting the data, 42 patients in total were in our hospital, and less than half, 19 of those, were Lane County residents. And really what we are beginning to see is transports moving into the Eugene Springfield area as the regional hospital hub for Region 3. And just touching base with the incident commanders at both of our local hospitals, our major hospitals here, hearing that things were getting tight, quote unquote, there, and that they were putting additional surge measures in place. Peace Health announced that they were going to limit visitations in hospital given the surge that we are experiencing. So we continue to watch these hospital data. You'll see Region 3, which Wayne County anchors, 510 total beds, non-ICU, 97 are currently available. And for our ICU beds, we only have 15 available, and these were current as of yesterday afternoon when we were consulting these data. In weeks past, we have talked a little bit about the percentage of breakthrough cases. So breakthrough cases are those who are who have been fully vaccinated. So they've received 2 doses of Moderna or Pfizer, or 1 dose of the Johnson & Johnson vaccine, and 2 weeks has passed since that last dose, so that they have gained the full efficacy of the vaccine. So we wanted to see and wanted to understand specifically what we were seeing in the case data. This took us some time to put together, as we had to go back, and we wanted to work in moving averages, because the daily results can be skewed by the testing results at a single facility. So we go back now, and we're calculating this on a 4-week moving average, and you'll see over the past 4 weeks, about 20% of our reported cases here are breakthrough cases, meaning that 1 in 4 of our cases were detected amongst those who were fully vaccinated. Over the past 60, I'm sorry,
20%, 1 in 5.
Sorry, 20%, 1 in 5. Yes, thank you for that correction, Chair Bernie. In looking specifically over the past 60 days now, and we need to go back with a larger time measure in order to capture more data. 16.7% of those who have been hospitalized in Wayne County were fully vaccinated. So those are breakthrough cases. So that is 19 out of 114 cases of hospitalizations. And among our deaths over the last 60 days, 3 of 19 deaths reported here in Wayne County, representing 15.8%, were breakthrough cases. So we are showing a lag in the number of Delta cases that have been sequenced and reported. These data currently being reported to us by OHA currently are 7. We know that we have a great deal more Delta in our community, and we know that that is lagging the reporting cycle, largely because of delays at the lab and waiting for those reports to come back to us. So the breakthrough cases are expected, as we have discussed many times in the past. The vaccines were developed not as sterilizing immunization, meaning that they completely made SARS-CoV-2 go extinct from our population, but rather protect people from severe disease, hospitalization, and ultimately death. In the cases in which we are seeing deaths, these are within our older population who, due to underlying health conditions, perhaps do not muster as strong of an immune response as others in the general population might. You'll see that in the breakthrough cases that are detected, they're pretty evenly distributed across the age brackets as well. So we are seeing teens, 20-somethings and 30-somethings pretty well represented in these numbers, but they go right across the board. So vaccination, of course, continues to be the way in which we must move forward in order to conclude this experience of SARS-CoV-2 and into our 15th month, I believe, or 16th month since we've really been responding to this emergency. 2 weeks ago, I showed you the current vaccination status here in Lane County. We were reporting 224,439 individuals in Lane County having completed their vaccination series or having begun it. And 2 weeks later, that number has increased only slightly up to 611 people here in Lane County. And so looking back, as we close the books in July, total vaxxed in Lane County is 5,655 individuals. As of these data, as we look at them, as of these data released yesterday, this represents 59.7% of our entire population. And that includes the 42,683 individuals who live here in Lane County who are 11 years of age or younger, thus ineligible. Taking the 42,000 individuals off, we have vaccinated 67.2% of our eligible population. So leaving, as of this morning, we have 111,071 individuals in Lane County who are eligible for vaccine who have not yet begun the vaccination series. And getting vaccination into the arms of those individuals remains the highest priority and the quickest way to get to the end of the pandemic and the resumption of normal activities. We continue our efforts as we have throughout the summer by providing vaccination clinic opportunities in distributed fashion throughout the community in each and every place where we can. We had a booth up and running at the Lane County Fair, and we're providing vaccinations at that venue. And we continue to have standing weekly vaccination clinics at Churchill High School at North Eugene. We are opening for weekly at Echo Hollow Pool, returning to a venue that has been helpful. And certainly as individuals are looking to escape the heat of August, we hope to be able to meet them there for opportunities for vaccine. The efforts as we look forward to the conclusion of summer and pivoting into fall. We recognize that back to school is just around the corner. This week is in fact the last week that individuals can begin a vaccination series for school-age eligible children, 12 years of age and older, in order for them to be fully vaccinated by the first day of school, which is the week following Labor Day throughout Lane County. So we are encouraging individuals who are sending their children back to school and who are age eligible. This is a good week to begin the series. Vaccination opportunities are very widely available throughout the county. We are in touch with each of our retail pharmacies, distributing vaccine that we have on hand to them, and continue our own operations as well. Chair Bernie, I think that is the conclusion of my prepared remarks to you this morning.
Well, thank you. Very sobering. Before I ask commissioners for questions, I saw Commissioner's Buck hand up, so you will begin, Commissioner Buck.
Thank you, Chair. I was wondering if you could touch on children's vaccines under the age of 12 and how that is going, and if the timeline has changed or moved as to when they can get vaccines.
Chair Bernie, Commissioner Buck, we have not heard any additional updates from CDC or FDA, nor the vaccine providers beyond what has been mentioned previously, that we anticipate Pfizer moving forward with an expansion of the EUA request in September. We believe that that will likely move through the process very quickly as they evaluate the data and it goes through the advisory committee process. It is our hope that we will begin to be able to offer vaccine to those individuals as soon as October.
Just a quick follow-up. Is that something that public health will be doing or through pediatricians or a mixture of both?
Chair Bernie, Commissioner Buck, that I think remains to be seen. So as part of the process of approving the vaccine at FDA, it then goes to CDC, who then gives clinical guidance specifically around the actual administration of vaccines. It is possible that CDC would recommend that a pediatric setting would be the most appropriate for those individuals. We think that school-based clinics would likely also be another good venue. We are looking at a number of different scenarios just from the planning process side so that we can be prepared to move very rapidly as soon as that is approved.
Thank you very much, Commissioner. Yes, Commissioner Farr.
Thank you, Chair Bernie, and thank you, Steve. Fantastic presentation, not one that we wanted to hear, but one that we perhaps anticipated. Thank you. A follow-up, more or less, I believe, to Commissioner Buck's questions, and that is regarding kids who are preparing to go into school who are below the age of 11. I have a neighbor, so I've heard of this directly, with a 5-year-old who is currently takes dance classes and is currently involved in a program called Kids in Transition to School. That's pre-kindergarten preparation for school. At one of our local public schools. Now, I don't know what to actually say. Should we be keeping kids out of these social situations, or do we have any advice that we can all kind of cling to give to people when they're saying, should I pull my kids out of Kids in Transition to School, for instance?
So, Chair Bernie, Vice Chair Farr, a very challenging question, and as a father of 2 children, one that I empathize with as well. So within the school age group over the weekend, just as we unpacked our cases yesterday, I had 30 5 to 18-year-olds reported positives. So we are seeing transmission. We are prioritizing our case investigation and contact tracing for individuals, minors under 18, as well as individuals 60 years and older. And this is part of our surge protocol so that we can handle the caseload that is coming at us currently. We are seeing instances of transmission in summer programs, in summer camps, and other kinds of enrichment activities. And we understand that those activities are so vital in the year following the school year that we've all just experienced, that our kids just experienced. So much of the summer programming is really meant to ensure that we help kids catch up to be where they need to be. That said, the masking update from CDC, I think, is incredibly important. Really, the science as presented last week from this case in Cape Cod, which showed a high degree of viral shed from vaccinated individuals from a very large outbreak in Barnstable County on Cape Cod, really suggests that even those of us who are vaccinated can transmit virus. And so as we're around those individuals who are not yet eligible, and certainly have other sensitivities, I think the burden of collective responsibility is for those of us to wear masks that can. So I think for every parent, there's a risk analysis that they themselves are going to have to make. It's very difficult for me or for anyone, I think, to really fully counsel other parents about their risk tolerance. So in those instances, I think I would be advocating for my child to be surrounded by adults who are masking and are following social protocols as much as they possibly can.
That is a perfect answer, Steve, and that goes along with what I'm telling people. In addition to remembering the protocols that we suggested a year ago regarding hygiene, regarding washing hands, some of the things that we perhaps, I say we collectively as a people of Lane County, perhaps have forgotten to wash our hands, perhaps have forgotten how to cough. And I especially like the last that encourage parents to make their own evaluation, and that they're around adults who are masked. Very brief follow-up to that, Chair Bernie and Steve, is that we had a testimony this morning that said masks are horrible incubators of disease. That's a paraphrase of what somebody said this morning, but you know, for kids who are wearing a mask for 3 or 4 or 5 hours in a transition to school program, for instance, is there danger that we know of, that we can directly point to, that other diseases are going to be harbored in those masks?
Chair Bernie, Vice Chair Farr, I am not aware of much in the way of risk of other dangerous diseases being harbored in masks over a short period of time. There is certainly regular hygiene that one should do on masks. If you're wearing cloth masks, wash them regularly. If you're using disposable masks, obviously no need at this point in the pandemic to use the same mask day in, day out, as we had to do very early on. So one is able to get masks on a routine basis, and many of these camps are providing them to their attendees. So I see very little in the way of risk congruent with the risk posed by Delta.
And you know, Steve, that may seem like an unfair question that I asked you, but I really asked it to you in the form of a softball, which you hit out of the park. Masks are like any other article of clothing. Maintain clean masks, change them as needed, and make sure that you observe your personal responsibility to keep them clean. So thank you, Steve. And thank you for, you know, I've had a chance to look in the door of a transition to school program and watch how that is happening in the Bethel schools. And really exactly what you're talking about is what I'm seeing inside of those programs. So just for the record and out loud once again, that parents need to evaluate the risk on their own personal level as to how they work with their kids in summer programs and transition to school. Steve, thank you. And Chair Bernie, thank you for allowing me such a long amount of time.
Always. Thank you, Commissioner. Are there any other commissioners that would like to? Yes, Commissioner Trieger.
Thank you, Chair. Thank you, Mr. Adams. I think for me, the most important and sobering comment was the one County Administrator made in introducing this agenda item, which this really isn't a continuation of COVID-19 update. This is a new pandemic that we're facing with this variant, partly because now, even with so many people vaccinated, understanding what kind of viral load lives in the nasal passages, we vaccinate to protect ourselves, we wear masks to protect others, because even us as vaccinated folks can be harboring this highly transmissible variant. And because of the exponential spread, everything I'm hearing is that is what is really scary, which means this is just moving so much faster than COVID-19. And that is of great concern to me. And I'm going to loop back to that in a minute with a sort of question/request for staff to consider. But before I do, I want to ask if it's possible to add to your updates a metric that we have yet to use, which is not just number of cases, number of hospital beds, number of ICU beds, but staffing capacity, provider-patient ratio numbers. Because we heard this was, approaching crisis conditions months ago, and now it's even worse with people who themselves have become sick, who are overwhelmed by the task of caring for so many, who are taking advantage of the pandemic to pursue new career paths, that we're facing an even greater staffing provider shortage everywhere, but in this case, particularly in healthcare settings. So if that's data that's possible for you to provide, I think it would really help round out the picture of exactly what we're facing in future updates. It also just reinserts the human element here, in addition to people who are sick with COVID, but the human element of the burden that we're placing on members of our community tasked with caring for them. Circling back to my concern about how fast moving this variant is and how slow moving by nature institutions like local governments are. I know the agenda's already been set for next week. I know a while ago we talked about maybe not needing such frequent updates. And I know that 2 weeks from today we have a down week and won't be meeting. I'm really worried about what we're going to see 3 weeks from today. And with that, I'm asking, and I don't know if this is a question for you, Mr. Adams, or for our administrator or others in our public health department, but I'm wondering if we don't want to move these items to a Board of Health item, so that should there be recommendations or actions we could be taking, we're using that authority to receive staff recommendations and to take any actions or make any community encouragements or messaging or what have you. But I'm asking for a consideration that we gavel in as the Board of Health for future updates until we are truly on the other side of every permutation of this pandemic.
If I may, Mr. Adams, point of information, Commissioner, this will be on our agenda next week.
Terrific, thank you.
Just Chair and Commissioner Trieger's comment, I don't know that I have an opinion about it. It's probably not a bad idea for you to do that. It would give you the flexibility to take action as the Board of Health if you felt you needed to, but it's really up to you. So if you feel like we would just want some direction from the board, and if you'd like to, schedule this and gavel in as the Board of Health, then we would need to do these items, the COVID updates in particular, under agendize it as such so that you would do that at the meeting. And it may be something, I'll just say, if you don't want to wrestle with that now, maybe something that you just ask the agenda team to consider. If there's generally support from the board to do that, to consider doing that, and then we can discuss it at agenda team.
Yes, Commissioner.
Can either Mr. Mokrzycki or Mr. Adams share with us off the top of their head any downside to doing it that way?
I can't think of any downside other than, it's kind of a process logistical thing where you have to take a few seconds to do that. I'm not, let me think about that and get back to you in the course of the meeting. And I certainly can consult with Ms. Gaffney and our Health and Human Services team to see if there's any reason we wouldn't want to do that. But if your desire, again, is to have flexibility to be able to act as quickly as possible in response to needs, then I think that's the upside, and I'm not exactly sure what the downside would be. But I'll let me check on that and get back to you.
Thank you.
Thank you, Commissioner. And again, Mr. Mokrzycki, Commissioner, this will be an agenda item next week. So the 3 weeks that the Commissioner mentioned, which would have made sense given our conversations, it's already gotten built in because of the priority of this. Any other Commissioner? Oh, I'm sorry, Mr. Adams, were you going to respond to anything Commissioner Trieger mentioned? I apologize.
Indeed, Chair Birdie. I just wanted to know, Commissioner Trieger, thank you for your excellent question. So the hospital data that I presented previously are staffed beds. So within that data set, you're automatically getting what is fully staffed. And sometimes if you as one does, watches those data over time, you'll see that those numbers go up and down. And it's not because we're losing hospital rooms, but it is a staffed room. That said, hospitals and ICU beds are obviously point of the spear here in terms of what we're dealing with. But we're also seeing similar issues that you elevated in the long-term care facility realm and others as well. And so I will endeavor to see what I can find to give you a state of the staffing levels within those settings outside of hospitals.
Much appreciated, thank you. And I'll just conclude saying, in addition to maximizing our ability to be responsive in my request to consider making this a Board of Health item standing, just sort of circling back to a lot of the comments that we heard in public comment, really are comments that need to be directed to the Oregon Department of Education or to your local school board. The Board of County Commissioners don't have any authority over policies around schools and the practices of masking in schools. And so this is just another opportunity for us to make sure that we're operating in and having conversations within the scope of what we are able to do. Thank you again.
Thank you, Commissioner. Yes, Commissioner Bozovich.
Thank you. Yeah, I just want to express that I am, one, not as alarmed by the Delta variant as it seems that a lot of people are. We're still seeing a hospitalization and fatality numbers that resemble the same numbers we had on June 30th when we lifted all the restrictions in the state. And even in your data about breakthrough, your number of cases of breakthroughs are a higher percentage than the number of deaths of people that have breakthroughs. So obviously the vaccine's having some impact on mortality, even in the breakthrough cases. And I kind of wonder in the breakthroughs, how many of those breakthrough cases were people that either didn't get their second vaccine within the recommended time limits or had some other procedural issue relative to mixing vaccines or and other cases like that. But I have a quick question. Do masks protect the person wearing them?
Chair Bernie, Commissioner Bozovich, I think there is protection for the person wearing the mask, but it is also protective of those who are not wearing masks or others in the community. So I don't think it's a binary, it protects one or the other. I think it's protective of both individuals in a social interaction.
I don't disagree with that, but I just want to make it clear that they do protect the person wearing them, which means somebody's individual decision to wear a mask is about protecting themselves. Just like the individual decision about getting a vaccine protects yourself, as well as it will protect others. At this point, is there any shortage of vaccine, and is there any cost in getting a vaccine, and is there any real problem in finding a vaccine in this county or state?
So Chair Bernie, Commissioner Bozovich, vaccine is free to anyone. It is readily available. There are certainly, I think, some members of the community who may have access issues, timing, availability issues. We're working to remove those barriers as rapidly as we can, but it is readily available throughout the county.
So we've got a significant amount of our population is vaccinated. Most people that want to be vaccinated have the opportunity for free, and timing and access wise, almost every pharmacy in this and medical provider in this county provides it. If you have the ability to pick up a prescription from your pharmacy, you have the opportunity to get a vaccine. And I haven't heard of people saying they don't have the time to pick up the prescription. So I just want to note that folks that are concerned and parents that are concerned have the option of wearing masks. No one is banning the wearing of masks. Anyone that wants a vaccine can get a vaccine at this point. I believe some of our hospital bed numbers have been manipulated. They drastically changed from last December to May over time in the state as what was reported available hospital bed wise. So I'm not so sure we're really at a crisis there. I just want to walk lightly about any discussion of mandating at this point where it's really people's personal decisions. And I am a strong promoter of getting the vaccine. And if I have a person that says they're uncomfortable, I will wear a mask around them. It's not that I don't believe, do that, but I also believe at some point, this is a personal freedom and a decision that people make for themselves and their families. And I can't force somebody to get vaccinated. We had, Nuremberg and a few other things kind of talked about forcing people to get medical procedures. And I'm not going to force people to have their children wear masks that, have autism and other issues. So I want to say, please, the rest of the board, tread lightly. And I read the CDC report that backed their guidelines. I don't know if other people did, But a lot of what they referenced were foreign studies that included the AstraZeneca vaccine that's not even approved for use in this country as far as the breakthrough and viral loading goes. So even there, I'm concerned about data being used that's really even not applicable in this country. So I at this point, I'm also concerned that our APMs tie to those CDC guidelines, and that there's problems in doing that, where we're automatically doing things just because the CDC comes out with something based on studies about a vaccine that isn't even used in this country. So I want to express my concerns that we should tread lightly, go lightly, and jumping back into mandates and all that only provides the side that is anti-vaccination and is trying to make this all about control, et cetera, gives them ammunition. Say, see, doesn't matter, get the vaccine or not, they're going to mandate stuff and take away our freedoms. It's a bad message, if you ask me, and I think we need to be very careful about any actions we take moving ahead.
Thank you, Commissioner. Steve, do you want to respond to that before I provide? No, you don't have to.
Which Steve were you asking?
Okay. Yes, Commissioner Buck.
I have a question on the cycle of these pandemics. Specifically, when a pandemic like COVID-19 comes, we have vaccines, but not everybody gets vaccinated for the sake of yourself, the community, everything. Then you get the Delta variants or other variants going around. And then eventually you get so many variants that the initial vaccine for the initial issue is how effective is that after the fact? I mean, the point that I'm trying to make is we live in a community, and we have to think about the long-term effects. And if we don't all get our vaccines, what the ultimate recourse comes back to being, well, do we have to provide all new vaccines and keep doing vaccines for the rest of the lifespan of COVID, or whatever it morphs into being?
So Chair Bernie, Commissioner Buck, so absolutely, coronaviruses, like other organisms, evolve and mutate over time. The more hosts that are available in a global pandemic, in a global sense, the more humans that are around and unvaccinated are capable of producing additional mutations that in the future, and certainly the worst case scenario is that we get a new mutation that defeats the existing virus, or the vaccine rather, that was initially developed for the first wild type SARS-CoV-2 last year. So the science continues to evolve as well, and the vaccine manufacturers are already putting new mixtures into play and into trials that are able to try to keep up with the changing mutation of these variants as we see them. What I think is concerning about Delta that we haven't seen is the relative rate of spread that appears to be much more robust with Delta than we've seen with the Alpha variant. And we used to talk about these as from the place where they were first identified. Alpha being the UK variant, we were talking about that back in April, and Delta being the Indian variant, which was first identified in Mumbai. So absolutely, these mutations wash through the population. The sooner that we can maximize vaccinations, that reduces the number of hosts that are available to continue to manufacture additional mutations.
Thank you. Commissioner Bozovich, I would like to say something here, and I really don't want to back and forth, and I'm doing my best to keep us on agenda because this is a long one today, so forgive me. First, I would like to say that no one here at this Board of Commissioners, it's not on our plate or our business to be talking about a mandate at this point in time. So we're not treading lightly, we're not treading heavily, we're not treading at all. We're getting an update on the data that Mr. Adams is providing us. I think it's important to note that only because I think it's a misnomer. We heard a lot of public comment today, and I have a great deal of empathy for the comment, but I think what Commissioner Trieger stated is we need to look at what our authority is and what our authority is not. And at this point in time, when we talk about the 16 school districts, public school districts in Lane County, we do not have authority over those districts. We don't tell them what curriculum to teach. We don't tell them when to open, when to close, how many days in the school year, et cetera. We do not have that authority. Mr. Adams, am I incorrect that of the eligible for vaccination, Lane County is below the national average now?
Chair Bernie, we are above the national average.
Because I keep hearing last night that the president reached his 70% level.
Chair Bernie, there's so many different figures and percentages thrown around, and it just depends. So the 70% is 18 plus, and the number I'm giving you is 12 plus.
Thank you very much. You're right. That's why I asked. I didn't make the statement. Another question for you, Steve. Does Lane County have the third highest transmission rate in the state of Oregon right now?
Lane County, third highest transmission rate in the state of Oregon. I do not know, Chair Bernie. I would have to go back and look at the data. But we, just as I eyeball the daily numbers of the last few days, I would not be surprised if we're not in the top 5.
Okay. I requested information on last week you provided, or not last week, but our last board meeting, the zip code distribution of vaccine. You did not do that this time. Could you do that with every report? I find that very insightful.
Absolutely,
awesome.
Chair Bernie.
Thank you. And we also asked for, when we looked at hospitalization and transmission rates, vaccinated versus unvaccinated. Did you provide that this time?
Indeed, Chair Bernie, that was the breakthrough slide.
That was the breakthrough slide.
That is, yes, and that is the vaccinated versus the unvaccinated.
Okay, my only comment now, and thanks very much, Steve. I'm trying to sort this in my head. My only comment is that this is so distressing and depressing. I think I can speak for myself and many when I say it felt like freedom to just rip these masks off, go to the gym, start going, to activities, which I've done a lot of. And it felt so normal and natural and such a relief. And to look at this data and hear, the facts are the facts. It's just, it's sobering. And I think we need to take this very seriously. I can tell you, and this is impacting so many people in so many ways, but I just learned as a result of this data, I just learned this, that I won't be able to be in the hospital when my grandchild is born this week. And the way this is impacting so many people in so many ways, it's tough. So, and it's tough to see, how people fall on different positions passionately, and it makes sense. Every position, it's not as if there's not a rationale for it. When my wife and I were flying home from the National Association of Counties Conference in early March of 2020, I know Commissioner Buck remembers this, although she stayed, she was braver than we were, a couple of days longer. I sat next to the head of one of the, I forget, it's the University of Chicago Medical Clinic, University of Illinois in Chicago, and he's the head of epidemiology, and no one knew how significant this was going to be. And on the one hand, it was a very touching moment because he shared his father was in Buchenwald, and Maddie's father was part of the troops that helped liberate Buchenwald. But then it got to his assessment of this, and he talked about how this was going to, variants were going to occur. It was going to get worse. That if we didn't stop the spread through massive vaccination, that variants would defy potentially some of the vaccinations, which we're not at yet, which is another reason it's so important to increase the vaccination rate. And this gets to Commissioner Buck's point, which was that it's very conceivable if as a community we don't reach higher levels, that variants will in fact develop naturally that will defeat the vaccinations that we currently have. So my sense is that this is a race, that it's a time-sensitive race, and somehow we need to get, as Commissioner Bozovich said, more and more and more and more people choosing to take the vaccination for the sake of all of us. That's my only comment. Commissioner Bozovich, I know you had your hand up, and then we're going to move on if that's okay.
Yeah, I briefly just want to make sure something's clear, because I think Commissioner Buck's comments may have muddled this a little bit. The current vaccine is effective against Delta variant. And I just want to make that clear. The number of people vaccinated in our community versus the breakthrough cases is very small when you compare the two. What are we at 200 some thousand vaccinated, and the breakthrough cases were 20% of the 4,000 cases, recently. That's a pretty small number. What we're seeing is 80% are unvaccinated people.
Right.
If you're not vaccinated, you're definitely not protected against the Delta variant. And I just wanted to make that clear and make sure people understood that. And yes, there will be continued mutations. Just like influenza, you're probably going to see boosters coming around every year to try and deal with those. But, when we're talking about communicable disease, the Delta variant got a larger RO. It's more, contagious. But the fact that we've gotten such, a large proportion of our population vaccinated, the actual mortality and hospitalization rate is lower. So there's two factors of how dangerous a disease is: how easily it spreads, how impactful it is as far as death and serious complications and hospitalization. And we're starting to see that factor go down, even though we're seeing a contagiousness maybe go up with this particular variant. The next variant may not be as contagious, and we don't know. But I just, you judge, communicable diseases by several factors, and contagiousness is only one.
Thank you, Commissioner. And Mr. Adams, is there anything else on this item before we tackle the rest of our agenda?
I don't think so, Chair Bernie. Thank you so much for your time and the time of the board.
Thank you, sir. Thank you, commissioners. We are now at the beginning of the consent calendar. Do I hear a motion?
Chair Bernie.
Yes, Vice Chair Farr.
Thank you. I move the consent calendar for August 3rd, 2021.
Is there a second?
I'll second.
Thank you, Commissioner. Diana, flip the screen on. Was that Commissioner Buck that seconded?
Yes.
Thank you. It has been moved by Commissioner Farr, seconded by Commissioner Buck, to approve the consent calendar for August 3rd, 2021. Is there discussion to the motion? Seeing none, I'll call the question. All those in favor of approving the consent calendar, please signify by saying aye.
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 Are there any opposed? Let the record show that the August 3rd, 2021 consent calendar moved by Vice Chair Farr, seconded by Commissioner Buck, has been unanimously approved 5-0. Item 7, Human Resources. Order 21-08-03-08 in the matter of establishing a $15 per hour minimum wage for Lane County positions. Again, we have with us to review this. Here I go again. Diana, will you help me? I'm going to say the first name. Diana?
Subchinsky.
Subchinsky. Thank you very much. Ms. Subchinsky, please.
You're welcome. Thank you, Chair Bernie and Commissioners. Good morning. I'm Diana Subchinsky, Senior HR Business Partner for Lane County Human Resources with a focus in compensation. This presentation is a follow-up to the discussion we had a few weeks ago. I'd like to present you with a brief history of this board packet in the matter of establishing a $15 per hour minimum wage for Lane County positions, and then return the floor to you. In July 2019, the board asked the county administrator to have staff research Oregon counties that were establishing a minimum wage exceeding state law. In December 2019, HR presented their findings to the board, and the board assigned HR additional research to determine the financial impacts of increasing the minimum wage for entry-level employees to $15 per hour. As a result of shifting priorities due to the COVID-19 emergency, the topic was delayed from returning to the board for further discussion until this year. On July 20th, 2021, HR returned to the board to present the results of the analysis of the financial impacts of establishing a $15 per hour minimum wage. Based on the information presented, the board directed staff to create a board order establishing a $15 per hour minimum wage for Lane County positions to be placed on consent calendar. Since submitting the board order, it was removed from the consent calendar and is the item I present to you today for your consideration. Chair Bernie and Commissioners, thank you for your attention. At this time, I refer the floor back to you and would be happy to answer any questions you might have to the best of my abilities.
Has anyone else noticed how Ms. Subchinsky makes us kind of look a little amateurish in our presentations? Thank you very much, Ms. Subchinsky. Are there any questions or comments? I don't remember why this was, oh, okay, I'm sorry, Commissioner, no? I don't quite recall why this was pulled from consent calendar. I know it was originally there, so perhaps whomever pulled it could lead on this discussion. You don't have to. Yeah,
I pulled it just so I could have an opportunity to vote differently than the consent calendar. Somebody make the motion and all that. I assume it's going to get approved, but I just want to have my ability to vote no.
Absolutely. Commissioner Bozovich, it shall be preserved. Yes, Commissioner Bug.
I'm prepared to make a motion so we can discuss.
Please.
So I'll move approval of Order 21-08-03-08 as presented.
And I'll provide a second.
It has been moved by Commissioner Buck. Not yet, excuse me. Order 21-08-03-08 in the matter of establishing a $15 per hour minimum wage for Lane County positions has been moved by Commissioner Buck and seconded by Commissioner Trieger. Is there discussion to the motion? I'm sorry, Commissioner Trieger, you had your chance. No, I'm sorry, Commissioner Trieger, yes.
Thank you, Chair. Lane County didn't invent discriminatory pay scales and inequitable wage gaps, but we can be part of undoing systemic harms of the past and helping close those gaps. On a national level, wages haven't merely been stagnant, they've been actively and intentionally suppressed through public policy. And Lane County government policy is no exception. This is an opportunity for us to make good on our stated values around equity, human dignity, and to help improve our local economy by putting more dollars into people's pockets, dollars they'll spend in local businesses all over Lane County. The price tag of a yes vote is a mere $25,000 out of a nearly $800 million budget. But a $15 minimum wage makes a priceless statement about how we value our workforce, and a no vote makes a similarly strong statement of a willingness to exploit and neglect the most basic needs of the very people we rely on to deliver services and fulfill the goals of our organization's strategic plan. Claims and comments about low skill or menial or entry-level work are red herrings designed to detract from the real conversation we need to have about how or even whether we truly value labor. This is an opportunity to be part of a national movement and demonstrate local leadership by showing we're paying attention to the needs of everyday working people, as well as to our own organization's bottom line. And I will be an enthusiastic yes vote on this long overdue board order. Thank you.
Thank you, Commissioner. Are there any other comments before we? Yes, Commissioner Buck.
I want to appreciate Commissioner Traeger's comments there. I brought this up as a work session in 2019 when I first began here as commissioner. It's taken us a while to get here, but I appreciate all the work that the county has put forth. I know that this board order means a lot to our workforce, especially those who actually are making under $15 an hour. And we know that there'll be ongoing contract negotiations with our unions that also address this issue, which I appreciate in the write-up. It absolutely is a statement of our values. It's also very clear that $15 minimum wage still does not afford a decent house or apartment in our community. That we've noted a couple of years ago was in the $17 an hour range. So although it is not necessarily the wage that I would like to see us ultimately achieve, I would like to eventually see us being able to provide wages that can afford housing in our area. This is a really good step forward. Staff has put in a lot of research on this, and we've had to pause given COVID-19 and other large issues that have been in front of us. I urge the rest of my board members to vote yes. Thank you, Chair.
Thank you, Commissioner. Are there any other commissioners that would like to make a statement? Oh, yes, Commissioner, Vice Chair Farr.
Thanks, Chair Byrne. And I think this is a timely movement on this particular item. And since we first began speaking about this, a lot of things have changed in the labor force. You know, there's a very distinct labor shortage in our community. And you experience this particularly when you go to towns like Florence, which has a relatively small number of people who can afford to live there and work there based on the cost of housing alone. So it really is a move in the right direction. If you go to Florence right now, you'll see that the fast food restaurants are paying $15+ an hour. That is kind of the market, and that's what they're paying just to attract people to come to work for them. Currently, I spoke to someone who lives in an adult living facility with varying levels of care, as many adult living facilities are. They cannot find a maintenance person to conduct the ongoing maintenance because of the wages that are being paid throughout the community. You know, the pay scales are elevating right now, and I think that we need to keep a close eye on that. I think $15 an hour doesn't pay the mortgage, or certainly doesn't pay the mortgage, and probably doesn't pay people's rent, but it gets us a step in that direction. And when people work for Lane County, I think I would like to have people working here who feel good about the rate of pay that they're bringing home. We can be an example, and that is why I'm voting yes on this. Thank you, Chair.
Thank you. Seeing no other comments, I'll make one. I think we should be, just to churn this up a little, this request was, I remember when Commissioner Buck made this request when she and I first started on the board. I think the request was germane 2.5 years ago. I think we should probably be talking about $16 or $17 an hour now. So this really, at a cost to the county of $24,000, we're talking about what Mr. Mokrahysky, how many people work at Lane County? I'm just checking to see if he's here.
Yeah, always here. Well, not always. Approximately 1,700 full-time equivalent positions.
Thank you very much, sir. So when you're talking about an employee base of 1,700 people and a cost to the county of $24,000, so that we quote unquote lift, but there's not much lifting going on here. The county's already done most of the heavy lifting, I think. A few people, so that they're able to make $31,000 a year, which, by the way, is a gross income of about $2,600 a month. And a 2-bedroom apartment in Lane County costs about $1,200 or $1,300 a month, which would mean they would be incredibly burdened just for the average cost of a small apartment. I think it's a little bit overwhelming, and that's why I'll be voting yes on this too. Are there any other comments at this point in time? Okay. All those in favor, and by the way, before we vote, Ms. Subchinsky, thank you so much for bearing with us as we go through this process. Your data is indisputable and very insightful, so thank you. It has been moved. I gotta believe Commissioner Buck moved this. It has been moved by Commissioner Buck and seconded by Commissioner Trieger. Order 21-08-03-08. All those in favor, please signify by saying aye.
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 All those opposed?
Nay.
Let the record, thank you. Let the record show that order 21-08-03-08 in the matter of establishing a $15 per hour minimum wage for Lane County positions has been approved by this body 4-1 with Commissioner Bozovich voting nay. Thank you.
Thank you, Chair Berney and Commissioners.
We are now on item 8A, order 21-08-03-09 in the matter of authorizing the county administrator to enter into a 50-year lease agreement with Friends of Buford Park and Mount Pisca. And we have with us a number of people, and Brett Henry, our Parks Division Manager, will begin and lead this discussion, I think.
Hello, Chair Berney.
Oh, yeah,
Actually,
sorry, Dan Hurley.
no, sorry, I should have given you a note about that this morning. Brett's actually out today, so I'm going to be pinch hitting here for him today. But it gives me great pleasure to talk about this item. Good morning, Commissioners. We're here to propose that we enter into an agreement for a 50-year lease with the Friends of Buford Park and Mount Pisca. And I'm joined here today by the Executive Director of Friends of Buford Park and Mount Pisca, Janelle McCoy. And I believe Ed Alverson, our Natural Areas Coordinator, is also on the line, as well as Jason Blazar. And Jason, I'm not sure your title, but he's carried out many large restoration projects for us out at the park. So Mount Pisca, is our most beloved park. Its official name is Howard Buford Recreation Area, but most people know it as Mount Pisca. And we've had a long-term relationship with Friends of Buford Park for 32 years, I believe it is, since 1989. They have been an essential partner in building the park out to what it is, with miles and miles of trails, taking care of the invasive species and restoring native prairies and other ecosystems out there. If you've been out there, it's a very, very special place. And we have Friends of Buford Park to thank for a lot of that. So Friends of Buford Park, we've been in agreement with them for all those years, but they've never had a lease for a part of the property. So this is something new. We've had a lease with the Arboretum, I think, since their inception. We, in 2019, brought to the board an agreement to go into a 50-year lease with the Arboretum that the board approved. And so we're looking at a similar arrangement with Friends of Buford Park. Friends of Buford Park has made a number of investments in an area we call the North Bottomlands, off to the left as you come into the area where they have their native plant nursery. And there's also a couple of historic structures, the Kinzel House and Barn, that the organization would like to carry out some restoration on and utilize for various functions. So a lease would allow Friends of Buford Park to make those investments, to have assurance that they're going to be there for a long period of time, which I can't imagine how we would function without them, particularly given the funding resources that we have for our parks division. Friends of Buford Park has shown their ability to carry out major restoration and to do fundraising. They've brought in literally millions of dollars into this park over the years through acquiring grants and through donations, and just such a strong partner. So I wholeheartedly recommend this lease. If you have any questions, you could direct those to myself or Janelle. And I think that about covers it, unless Janelle, is anything you want to add?
You did such a great job, Dan, of most of my talking points, actually.
Okay, sorry.
I just want to, that's okay. Yeah, I just want to thank all the commissioners for having this on the agenda. I want to thank the relationship that we have with the Parks Division. It's been a very fruitful one, and the opportunity to provide the care for this, this green space in our community, which receives 500,000 visits throughout the year. Something that we saw as you were talking about COVID-19 and all the metrics with public health. We saw more visitors to the park than, during this pandemic than we have, other times of the years historically. So we know what we are doing for our community provides, mental health, physical health, and we so appreciate being a part of that story. A lot of the structure that we do have there in the North Bottomlands, in addition to the historical structures, our nursery as well, provides restoration materials for the rest of the park, and it is very niche to the park. Some of that material has also gone up the Mackenzie to help with fire restoration efforts. So we really view ourselves as being able to be there for our community and to encourage our community to follow our lead as well in restoring their own habitats, whether it's around your school, your home, your apartment building, your place of business. If we work together, we can abate fire, we can conserve more water, and we can plant native plants that are much more adjusted to the climate that we see ourselves in these days. So I want to thank all of you for this time. Our stewardship director, who many of you have worked with over decades, Jason Blazar, is also on this morning in case we have a question that I cannot answer, but I'm so appreciative of the opportunity for your consideration.
Great, thank you, Janelle. So this is a concept we've been talking about for quite a number of years, but very most recently been working with legal counsel and in collaboration with our other partners, such as the Sheriff's Posse and the Arboretum, who also jointly use this space. So I think that covers it. Commissioners, if you have any specific questions, be happy to entertain those.
Commissioners, yes, Vice Chair Farr.
Thanks, Chair Bernie, and thank you for bringing this forward to us, Dan and Janelle. This is long awaited. I'm a frequent user of Buford Park and the area around there. Our grandchildren, as with many other people's children and grandchildren, have grown up in that park, witnessing the seasonal changes and all of the things that it's very difficult to find other places, anything like it, so close to the metropolitan area. So it's a valuable asset to us. There is one thing I would like to talk about a little bit and just make sure that my concerns are satisfied. And it's, let's see, 4.51 in the order. And that is the parties recognized at Mount Pisca Arboretum, the Lane County Sheriff's Mounted Posse, and other park users authorized by the county, etc. I'd like to talk about the posse a little bit. We don't talk about the posse too often, the things that they do for us as a county. We see them most frequently when they're parking cars at the fair. And anybody who went to the fair this year probably saw our mounted posse, including our retired sheriff, Byron Trapp, who is on the posse. But my question is regarding the continued use of the property in the shaded yellow area on the map in Exhibit A. That presumes that existent use by the posse will be granted, bearing in mind that it says they need permission ahead of time, notify friends in advance of such events. And I'm presuming that's not too different to the way the posse uses it today. But what about future considerations for posse use? The posse very specifically, because the posse is an unheralded but essential part of Lane County in terms of the things that they do in service to Lane County. And they do it without any funding from Lane County for the most part. So what about future use? Let's say the posse wanted to perhaps erect a stable there, or an arena for training horses there. How would they go about that?
Vice Chair Farr, I might actually have our staff speak to that. We were planning to bring this lease agreement to you a few weeks ago, and then we heard some concerns by the posse. And I know that after those concerns were raised, we had some meetings to work through those, and I think those were worked through to the satisfaction of the posse. So I do see Michelle Hunt and Ed Alverson popping on here. Do either of you want to speak to that? You've been firsthand to those conversations.
Yeah, so the boundary of the lease area, this is Ed Alverson from Parks. The boundary of lease area was tweaked a little bit with feedback from the posse on the north end. So excluding an area where there's an interest in potentially putting in year-round parking. But that portion, that eastern portion of the meadow there that's used every year for overflow parking for events, both Arboretum events and posse events, that function is built into this lease agreement. But so I just mainly want to say that there has been some back and forth about the boundary, and that's been adjusted with input from the posse.
Thank you for that, Ed. And unless there's something else to say, Mr. Hurley, you suggested that the posse has, in discussion with the posse, they're satisfied with this arrangement. Is that something I can take to the bank?
That's my understanding, Vice Chair. Unless, were there any other remaining concerns? I know there have been some meetings since we were originally going to bring this item forward. Michelle, are you aware, or Ed?
Yeah, no, we met on site with people from the Friends and representatives from the posse, and we talked this through. And so the boundary that is in the final lease agreement is the result of those conversations.
Thank you for the diligence on that. And then my question regarding future improvements in the area, whether it be a pole barn, pole structure, whatever it may be, is what provisions would be there for that? I've not talked to the posse about this, by the way, other than probably greater than a year ago, but are there any provisions for a potential improvement?
Well, the most recent conversations that Dan may not have been involved in was actually with search and rescue and their interest in installing a training facility in the North Bottomlands. But the location they suggested is outside the lease boundary, the Friends lease boundary. So that wouldn't be a conflict. That would not be precluded by this.
Well, that almost answered my question. If anyone were to want to build a structure inside of that facility, is there a process for application to do so?
Well, as I understand it, once the lease is finalized, anything that happens within that lease boundary is, it needs to be directed by or agreed upon by Friends of Buford Park. So anything could happen as long as it's consistent with the park master plan and the park habitat management plan. But Friends of Buford Park is kind of in the position of determining what would move forward or not. So the area where the Posse's arena is currently located, and all the area that they currently use for parking and other types of event activities, is outside of the lease area, or the parking function is built into the lease.
Thank you. That comes very close to completely answering my question. And I'll just reiterate, Mr. Hurley, that boy, I'll tell you, what we have there is a jewel within walking distance of the metropolitan area. And anybody who's not been there should take the time to go there. Be sure you get a parking pass before you go. Thank you.
Any other words to the wise there, Commissioner? Thank you very much, Commissioner. Are there any other comments or questions? Yes, Commissioner Trieger.
Thank you, Chair. I just want to really appreciate this, and I'm very excited to see it happen. And Ms. McCoy, it's good to virtually meet you. I worked at Mount Pisca Arboretum for a time, and I think a lot of people don't know that they're two different organizations, but there's such an important symbiotic relationship there between the Arboretum and the Friends. That long-standing relationship is so important, and just preserving and protecting the broader area is really important. It is, as many have mentioned, such an important community resource, and as we did see, particularly during pandemic, really kept a lot of people quite literally grounded to the natural environment. And not unlike our conversation about the interpretive center being built upriver, this is an important opportunity, I think, for us as commissioners. While we don't oversee educational institutions, our park system are part of educating particularly youth and children about the natural world and their role in it. And so it's really just so important that we do what we can to uplift and maintain these resources that we have for community. I think every single one of us could name life events. My own daughter was married at the Arboretum. I've attended memorial services for folks. I've taken many, many hikes in the broader Howard-Buford area. But I also do have some concerns about increased use. There is such a thing as loving our parks to death. And so I also really am glad that we can move this forward and entrust the stewardship to the organizations that know how to do it best, and make sure that it's both accessible and available, but also protected at the same time. Specific to the agreement, I do want to say I appreciate that there's a 5-year kind of check-in to review in an ongoing way that gives us an opportunity, all parties really, an opportunity to make sure that this long-term lease agreement is working in a more, the macro long-term agreement is working in a more micro operational way, and gives us a chance to make any adjustments we might need contextually when, I don't know, things like pandemics and wildfires happen and change the way we're interacting with our assets and the way communities interacting with natural resources or natural spaces. So thank you for all the work staff put into this. And thank you to the staff at the Friends of Buford Park and Mount Pisca for all you're doing to protect and preserve and steward this really unique and beautiful piece of land.
Thank you, Commissioner. Are there any other comments or questions? In that case, I only have one question, and that is, Mr. Hurley, why didn't you tell me during agenda setting so I didn't make a fool out of myself? I want to, if I may, thank Mr. Hurley, Ms. McCoy, Ms. Hunt. Sorry. But everyone, how's that? Because I recall this coming to our board when I had just become a commissioner, and at that point it represented tons and tons and tons of work and relationships and questioning over who the appropriate steward might be and who was willing to do this and had capacity. So I'm delighted that this is occurring, and I thank you all so very much for bringing this to fruition. So with that, if there are no further comments, the chair will entertain a motion. Yes, Commissioner Buck.
Thank you, Chair. As this is in my district, it's my honor to make this motion. So I'll move to approve Order 21-08-03-09 as presented.
Chair Bernie, I would love to second that.
By all means, thank you very much, and I appreciate why you would love to second that and why the commissioner made the motion. So thank you both. Thank you all. It has been moved. Order 21-08-03-09 in the matter of authorizing the county administrator to enter into a 50-year lease agreement with Friends of Buford Park and Mount Pisca has been moved by Commissioner Buck. It's been seconded by Vice Chair Farr. Is there discussion to the motion? Seeing none, hearing none, all those in favor of Order 21-08-03-09, please signify by saying aye.
Aye.
Opposed? Let the record show. Order 21-08-03-09, moved by Commissioner Buck, seconded by Commissioner Farr, has been unanimously approved 5-0. Thank you all so very much.
Thank you, Board.
We are now on item 9, County Council. Mr. Dingle, are there any announcements? Excuse me, Mr. Cheney. Are there any announcements? Because we are not yet on 9B, we're on 9A.
I am aware of none.
Well, I don't see Mr. Dingle, so it's all yours. If there are you here for item 9B, Jim?
Yes, I am.
Okay, I don't see Mr. Dingle. I will assume there are no announcements. So 9B, the first reading and setting the second reading and public hearing for ordinance 21-05 in the matter of amending Lane Code Chapter 1 to add procedures for renumbering the manual code and Lane Code for modernization and to update certain references and declaring an emergency. I'm delighted to see Mr. Cheney with us. Mr. Cheney, it's yours, sir. Please walk us through.
Chair Burney, commissioners, what you have before you is pretty much a housekeeping measure. As you may or may not be fully aware of, the county council is in the process of migrating the lane code and the lane manual from a Microsoft Word encoded version into a web-hosted version that is pretty much commonly used by most agencies to make it available to the public, whereas maintaining the security and maintaining a record of changes internally as it's changed going on. So in the course of that project, that has begun, and both versions, when you look at the lane manual and lane code, are currently posted. There's a renumbered version and an existing version. The reason this is here for housekeeping is it provides two things. First is an authorization to make the change to make the renumbering. But more important, in the case of the lane code, these are the rules that we enforce. And of course, as we renumber a section, it isn't necessarily possible to instantaneously also renumber every form that we use for enforcement or notice for people. So what this section would do is, what this section will do is authorize county council to make these changes, but also authorize both numbering systems as being official numbering systems until the project is complete, so that if a notice is given to do something and it references the new numbering or the old numbering, the public is on notice of how that system works, so they can look up what it is, and the public is informed, and we're giving the right information. I should mention also that this is a companion to Order 21-08-03-02 that was on the consent agenda that applies to the lane manual, which is being renumbered simultaneously.
Are there any other items? Is that it, Mr. Cheney?
That is it.
Thank you, sir. Are there any questions for Mr. Cheney? And Vice Chair Farr, did I see your hand? No. Yes.
Just make a motion when you're ready for that, Chair.
Thank you, sir. Well, I don't see discussion now, so Vice Chair Farr, if you would make that motion, and we can always discuss the motion.
Thank you, Chair. Then I move the first reading and setting the second reading and public hearing on ordinance 21-05 in the matter of amending Lane Code Chapter 1 to add procedures for renumbering the manual and Lane Code for modernization, and to update certain references and declaring an emergency. The second reading to be held August 21st, 2021, 1:30 p.m. with a time certain. And if we have a second, I do have a quick question.
Is there? Thank you, Commissioner Buck. The first reading and setting of the second reading and public hearing for ordinance 21-05 has been moved by Vice Chair Farr, seconded by Commissioner Buck. Discussion to the motion, Commissioner Farr.
Thank you, Chair Burney. And Mr. Cheney, and anybody, I believe that as a part of the first reading, any commissioner can request a complete reading of the ordinance. That's correct, right?
Yes.
I'm not going to do that. Thank you.
Are there any other questions or comments for Mr. Cheney or towards the motion? Seeing none, hearing none, all those in favor, Commissioner Farr, I'm going to ask you to restate that motion if you don't mind.
Thank you.
All those in favor of
approving the first reading and setting the second reading and public hearing on ordinance 2105, etc., with a second reading established August 24th, 2021, 1:30 p.m. time certain.
Thank you, sir. All those in favor, please signify by saying aye.
Aye.
Opposed? Let the record show that this motion on the first reading and setting of the second reading and public hearing on ordinance 2105 has been approved unanimously, 5 votes to 0. Thank you very much, Mr. Cheney.
Thank you, Chair Bernie. Thank you, commissioners.
And it really is good to see you again. It's been a bit. Mr. Dingle, are we doing item 9 in reverse order, or did you have no announcement?
I was undoing a paper jam when you called. So no, the only announcement I have is the one I mentioned last week is day 2 of our 2 support folks who started yesterday, Ms. Thompson and Mr. Chang. So I hope somewhere during the process you'll make your way through and say hello to them. But I don't have any other specific announcements.
Thank you very much, and congratulations on undoing the paper jam. Well, I'm presuming. We are now on item 10, County Administration. 10A, discussion, quarterly update on Equity 2.0 and Resolution 20-06-09-06. And we have with us both Mo Young and Judy Williams.
Good morning, Chair Bernie and commissioners. I'm hoping, well, first I should say my camera on my computer in my office is not functional. I'm not sure what's going on, so I apologize that my face will not be on your screens. I'm hoping that I can share my screen. I've made a really pretty PowerPoint to share, but I don't see an option to do that. So I'm just going to keep talking. An outline for what we're going to go over this morning is that we will be talking about the 3 focus areas that I do hope are familiar to you at this point: the normalizing, organizing, and operationalizing racial equity. The items under each heading have shifted a little bit, but we're still going to just keep using that language for the foreseeable future. Sorry, I'm looking to see if I can share. I still cannot. We'll start with normalize. So the Ferry Street Bridge board assignment. So you'll remember back a year ago, on July 21st, 2020, you directed staff to return with a resolution acknowledging the property destruction at the Ferry Street Bridge. You asked that we do a thorough examination of the Black experience in Eugene and also work towards creating an educational walking tour. That resolution was passed in February of this year, and there remains strong interest from both the City of Eugene and Lane County to provide public recognition of the dislocation of the across the bridge community for the construction of the Ferry Street Bridge in what is now called Alton Baker Park. The City of Eugene is working on releasing an RFP for a consultant to work on public art in 3 different park areas that are important to the history of Black folks in the area. And so our timeline has been a little bit stretched just based on the need there, but we're still an active partner and still in active communication with them. Next, we'll talk about the APM update and the competencies. We're still under normalize. Oh, hey, look. Hold on. I'm getting permission to share my screen, so hopefully. Hopefully it works. Oh, it's the wrong screen. There you are. All right, well, I'm gonna let you see my script because otherwise I'm gonna mess it up. As we look forward to continuing this work, it's become clear that we need to provide more opportunities to learn about diversity, equity, and inclusion concepts, both in the interpersonal area and in knowledge-based areas. And so as we work to implement the county's racial equity plan, there's more structure being created to support this work. And you'll see that we have a newly updated DEI training program in our administrative procedures manual that was passed on the 30th of June. And then I just wanted to share these 9 different competencies under knowledge and behavioral based. And so every employee will still need to complete a minimum of 3 hours of DEI training, 1 hour, a minimum of 1 hour from each of those competencies areas will be required as well. So 1 hour of knowledge, 2 of behavioral, or vice versa. Under the organizing heading, I wanted to share that over the last handful of months, I've been acting as a deputy equity officer in the EOC. That ended as the EOC shifted into its more official role into public health. But oh gosh, I'm still in contact with folks. This work happened in partnership with the equity officer and included working with community-based organizations using data to identify the areas and populations we should focus our vaccine outreach in, and with co-writing the equity plan that helped us go to permanent low risk, working on tailored messaging with the public information officer, and more. Outreach to community continues to include targeted small clinics and working with the community-based organizations to tailor messaging to the populations they serve. And then additionally, when the equity plan was approved, funding was allocated to assist in vaccine equity efforts. And I worked with the incident commander and the equity officer to author an RFP and reached out to the community-based organizations we've been connected with and others, encouraging them to apply to it. There should be organizations selected within the next week or so to receive that funding, and that money has to be spent by the end of the calendar year. You may remember last time we spoke about a root cause analysis. I just wanted to share that we had the first root cause analysis on the 26th of April. That one was focused on HR practices. The community wanted to talk about retention more than it wanted to talk about data. We got a lot of really, really good insight. And we learned a lot about how we need to, we learned about how we might format it better to get the information that we're looking for. And so our next root cause analysis will be focused on community engagement. There'll be more on that in just a second. And it'll be September 16th in the evening. We've planned 3 employee listening sessions. They will be all in September, the 9th, 15th, and 22nd. And then just an update on the Equity and Access Advisory Board. The focus this year continues to be to complement the work the county is doing that's outlined in the Racial Equity Plan. That includes hearing from departments and divisions across the county and making recommendations based on what they heard, supporting the strengthening of the equity program, and partnering with the county to identify how to help build accountability into the new Equity Lens tool. This summer, the advisory board has heard from HR and also public health. We'll be hearing again from HR on Wednesday's meeting. So tomorrow's meeting, this time focused specifically on recruitment and retention. On May 11th of this year, the board had a conversation about committees and ultimately asked that they be looked at with an equity lens. So it's important to remember that Lane County has lots of committees that are mandated, non-mandated, standing, multi-jurisdictional boards, task forces, and advisory bodies. Many of them can and do operate differently depending on bylaws and statutory provisions associated with the committee. And so because community engagement, including participation and representation on boards and committees, was one of the themes that came out of the listening sessions of last fall, we had already planned on doing a root cause analysis session with community in order to get feedback about that. And so that's the one that's coming up on the 16th of September. So we'll come up, what we've decided is we will create a problem statement and ask the community to do the 5 whys on that, to ask why that's a problem 5 times, rather than show data and let them pick. We hope that that will get us the information that we need to help address this board assignment. And so we'll continue to provide the board with updates in our quarterly equity updates, and then also in the strategic plan updates as needed. Equity lens update. So we're still working on the communication plan. We're still working on the pilot sites. Some of those pilots are just kind of a one-time thing. And some of them are things that need to go more than once. I wanted to share, I'm gonna see if I can do this. I wanted to share that this week we're going live with an Equity Lens page on our website. So as soon as I figure out how to unhide it, it will be live, so today or tomorrow. But this will enable folks inside the county, folks outside the county to access our tool, which is a form. And so people can actually fill it out. Our hope is that this will help us to collect information about what's working, what's not, where it's being used, maybe where we're seeing big gaps of it not being used. And I'm happy to send this link to you all to take a look at it at your leisure. And then I just wanted to share a couple of lessons learned about the Equity Lens. The committee met yesterday, and here's some of the things that we came up with. We have discovered that using an Equity Lens for an outcome is a little bit different than using the Equity Lens to examine the decision-making process involved. And so there are moments where it's going to be really important to use just one time. And there are also moments, such as the Holiday Farm fire recovery efforts, where it becomes really clear that we need to use it, monthly or at very specific intervals or time periods within the process. And so, like I said, the next steps is to hold the listening sessions internally, to hold the second root cause analysis with the community, to continue work with the City of Eugene on community engagement and the memorial for the Ferry Street Bridge, to continue the assessment of the Equity Lens pilot, and shift the tool as needed. And that is my presentation. So I'm going to unshare and open for questions.
Thank you very much, Ms. Young. I remind the board, this is not an action item, it's a discussion item. So are there any comments, questions, discussion with Ms. Young and Ms. Williams? Yes, Commissioner Buck.
I'll just share that when I'm coming into the office there, I've seen, large amounts of folks down in our old cafeteria area doing some of their continuing education on this, and it always seems packed. So I'm just so pleased as I walk by to know that our whole county employee divisions are engaging at that level. I think it's a great start. Look forward to more. Thank you.
Thank you, Commissioner. Yes, Commissioner Farr.
Thank you, Chair. And I'd like to speak to Mo directly on this. And Mo, it was about 8 years ago, I think, that you and I first met. and you began work on equity issues. And you were the person at the whiteboard for a lot of meetings when we brainstormed what are the things that the county can do to advance equity and access items. Not to go into a great deal as to what that work was initially at the time, it did ultimately result in the Equity and Access Board, which you are the chief staff person for, but it also resulted in the position that was created that you now occupy. And when that position was created, it became pretty evident who should fill that position, Mo. The point that I want to make with that is throughout the years, it's pretty remarkable the progress that you have guided this county through. And I want to thank you for that. And just wish you all the best as you move forward, because you know there's a long way to go. Many steps behind us, many steps ahead. Thank you, Mo.
Thank you, Commissioner.
Yes, I want to echo Ms. Young's statement. Thank you, Commissioner. Are there any other commissioners? Ms. Young, I don't see any other commissioners that want to engage in discussion on this item at this time. Is there anything else you would like to leave us with?
No, thank you. Just a thank you for giving me time this morning, and I look forward to seeing you all, I guess, next week, but also at the next quarterly report.
And hopefully you will give us the ability and the pleasure of seeing you next time also. Thank you very much.
We'll see if I can fix it. Thank you.
Thank you. Item 10B also is a discussion item. It's redistricting next steps, and Judy Williams will walk us through this process and where we are. Hey.
Good morning. Good morning, Chair Bernie and commissioners. I'm just quickly preparing to share my screen. Just a second. Make this a little bit bigger and I will begin. All right. So you can see that okay?
Yes, it's great.
Perfect. Thank you. So Judy Williams, a strategy and integration manager, and I work in county administration. And I'm going to just walk through a very brief 5-minute presentation on redistricting and then leave about 10 minutes for questions, comments. Really, what I was hoping to do quickly was just do a high level overview of the redistricting next steps, walk through a draft timeline that I've put together for you and for the committee. And then again, just turn it over to questions. And so a couple things I put here on the terms on the slide. There's a lot of material about redistricting, and I wanted to highlight a couple things. One term, Independent Redistricting Committee, although also known as IRC. You may hear me referring to that in the discussion. I just wanted to note that for the public. There's also a lot of material, this presentation and the board packet that's also available online as well for anyone following. And then quickly, the last discussion on redistricting happened on July 20th at the board commissioners meeting. And it was briefly, there were several comments or questions around what are the next steps? What's the timeline moving forward for the committee, for redistricting? And so this is just a very brief presentation to hope to answer some of those questions. So I've kind of put this into 5 phases, and briefly my role, I'll step back a little bit. My role in the future will be kind of your main contact for redistricting, as well as the IRC, the redistricting committee's main role in the future. County Counsel Steve Dingle did a great amount of work prior to myself kind of in this role. He will still be, called upon for subject matter experts. Cheryl Betchart, our county clerk, will absolutely be, subject matter expert, but moving forward, hoping to just give you and the committee one point of contact moving forward. So that will be my role in this process. So the first phase, as County Counsel Steve Dingle worked with you on, has been about a 15-month process to really make sure that we're doing the work. We've listened to the public. We've had the board work sessions. We've contacted anyone interested in this topic to really hear what their thoughts were on, prior redistricting efforts and what did they want to see. And so that phase 1 is preparing an inclusive process that's really transparent, fair moving forward. And the phase that we're in, kind of on the cusp of phase 2 now, is really the formation of that committee, the independent redistricting committee, and then just really doing as much as we can with that committee to prepare for once we do get the census data. And just a quick highlight on some of the details in this phase. And again, I won't go reading through all of it, and it also is in the board packet in further detail, but just to highlight, starting tomorrow is the intent to try and really reach out to, once we know who kind of the 5 applicants are of your choice for the redistricting committee, they need to work right away to get the other 10 members on board, as well as 3 alternates. We also have a lot of educational materials to give to the committee to start preparing for, what is redistricting, what it might look like, what are some of the timelines and deadlines, what are some of the software aspects. One quick piece that I was going to highlight here, it's highlighted in blue about halfway down, is kind of a decision point that we thought, again, Steve Dingle, Cheryl Betcher, and myself thought would be helpful moving forward. So in the past, we've used a software vendor for helping with some of the redistricting formation and boundary adjustments. We thought it would be good the state has an approved list of vendors that we would like to have the committee interview and actually choose a vendor themselves. And so that was one thing that we thought would be helpful, a quick decision point that I just wanted to highlight. Again, all of this is in the packet and I can answer other questions, but I wanted to move forward. Phase 3 is really that next process of really beginning the redistricting efforts. Once we've received this census data, the state has done their portion, Lane County, we can start beginning the work to adjust boundaries, talk about pros and cons, and really get into the details of that work. A couple highlights, again, briefly to point out with this phase 3, September 27th is the earliest date that we believe that the state will be done with their portion of redistricting. So again, they're going to be getting the data, census data. The state will be getting the census data August 15th through the 30th, sometime in that time frame. They also need some work, some time to do their piece. The earliest that we would likely see the state being done is September 27th. Kind of the last potential date is this October 18th of a deadline. So, depending on when we get the information from the state, that will really determine what our next steps are as a committee and when we can begin. And then phase 4 is really your role as the commissioners. So we do have a placeholder ordinance in place in case we weren't able to meet this timeline of doing redistricting every 10 years, which the date is by October 26th. So depending on when we get that data from the state and how fast we can turn that around, we have this placeholder ordinance. But we do plan to keep monitoring those dates and definitely keep you in the loop. But that phase 4 is really your role in hearing from the public, looking over those redistricting plan options that the committee will present and recommend to you. And then the 5th phase is really the final one where, everything's been adopted by the board. We choose, which plan, which redistricting boundaries work best, what's approved. There's a lot of pieces that mostly fall within election staff to complete and capture. And so the earlier the better, but we know we don't want to rush the committee, but there are some deadlines that elections really needs to work with. So, if we were to adopt an ordinance in late October, early November, there's a short amount of time frame that elections needs to really work with those respective cities and districts to complete those alignments. And then the absolute deadline for elections is January 31st to have everything complete. And in order to do that, there's about a month lag time prior to January. So election staff would really love everything to be done by December 31st, because there needs to be about a month of work just to get everything updated into the voter registration database. And really giving everything ready and in place is such a crucial piece for elections, as the timing of, you know, when people can run for office, it really depends on what that boundary looks like for them. And so getting everything in place is really crucial. And so this is just a high level, quick draft timeline that we put together for you that kind of walks and lets you know and the public know what to expect moving forward. So there is definitely a lot of work that we need to start, and the plan would be, you know, as early as tomorrow with the IRC committee that we've got, and then working with them to set those future dates so that, you know, working with a potentially 18-member body is going to be fairly challenging to get all of the dates and everything to line up. So just trying to get as much as we can ahead and out of the way so that when the time comes, we're not feeling like we're rushing the committee or anything. So that's really a brief timeline that I wanted to give to you. One last thing before I just turn it over to comments and questions is the Independent Redistricting Committee. We took applications. We received, I believe it's 46 applicants. So each commissioner was sent a packet of applications that we redacted a lot of the information according to what you requested. And so hoping to get by today or early tomorrow morning the applicant of your choice for your district. And then when, again, starting as early as tomorrow, reaching out to those 5 to then start assembling the rest of the committee. And so with that, I want to make sure there's enough time to leave any comments, questions, feedback that you have that we can adjust the timelines moving forward. I definitely have plans to update you as often as we can moving forward, whether it's an announcement or a monthly update or whatever works best for you. So with that, Chair Bernie, I'll turn it back over to you and happy to answer any questions that I can.
Well, thank you very, very much, Ms. Williams. That was really good. And I will reiterate what you have reiterated to me, which is the first date on that timeline moving forward is today. So I know you need those today. Do any commissioners have questions or comments? Yes, Commissioner Trieger.
Thank you, Chair. Thank you, Ms. Williams, for that presentation. I have a couple of questions just for clarity and then a brief comment. On your timeline, it says you want that ideally everything is to elections by January 31st, but in your presentation you said December 31st.
Yeah, the absolute deadline that elections has to be completed with everything is that January 31st. But in order to meet that, they need about a month of leeway time to complete all of that work. So you know, we're going to be really monitoring things in October, November. Again, the earlier, the better. And if Ms. Betchart was here this afternoon, she was out of town, so she would be here if she could. Would really highlight that the sooner the better. It just leaves more time to try and reduce any errors or anything else. And so the earlier the better, but absolutely being done by December 31st with anything with some of the political boundaries so that they absolutely have that month time to meet the deadline of getting everything into the voter registration database.
Yeah, so the January 31st is the clerk's deadline. Got it. That leads me to my other question for clarification when you bring up our county clerk and of course county council's here. Is your role, I wasn't clear whether your role is to be the liaison to the board on the project, or are you actually staffing the committee? And regarding staffing the committee, you know, there's a fair amount of technical and training expertise and content knowledge. So how will the committee be getting the technical support and resources they need? And could you specifically just clarify for me your role either in that regard?
Sure. Chair and Commissioner, a great question. So my role would be a liaison to the staff, or the liaison to the committee, as well as to you as the board in terms of if you have questions or to follow up with progress updates moving forward, that would be myself. I meet with, and I have been meeting with Dingle and Cheryl Betchart regularly since kind of the handoff transition, and we're planning things together. So when we do have the committee coming together, even before they meet in person, we're giving them material as a group, as a team. And definitely that first meeting, it's going to be, you know, Steve Dingle presenting the public meetings law parameters, Cheryl Betchart addressing election staff timelines, and bringing in, again, those subject matter experts as needed, depending on where we are.
Perfect. Thank you for that. One other quick question and then just a comment. The quick question is, I just want to confirm and make sure the committee knows once they gather that we're not required to make changes, that there is an option to keep things the same. We're required to assess and ensure the districts are drawn according to the rules and regs and parameters and keeping affinity communities whole and so on, but there's not a requirement to change. Is that right?
I'm going to grab
Mr. Trieger, I think that's technically correct. I mean, it would depend on the data, but I suppose that is theoretically possible, yes.
Great, thank you. Just wanted to confirm that in a public setting, that if the data supports leaving them as is. And then finally, I just want to say two quick comments. One, I'm really pleased to see the vendor selection process outlined, and that is part of how this is going to operate. I think that's really important, and appreciate that. And then just more broadly about the process, I know, as Ms. Young just shared in the equity presentation, right, sometimes the process is one of the outcomes, and this is a new way of embarking on this and establishing this independent redistricting committee, I think, is an important way of moving us forward, even if, you know, the current system is still a little flawed or has room for improvement or is imperfect, which I think this does, but it's a great start. And I'm really thrilled to be part of this new model of creating a sort of arm's length but transparent community engaged process for this critical function. Even if, you know, the identity of some of the applications was maybe ultimately you could figure out who some people were by the content of the narrative of the answers to their questions, for me, it was still really helpful to not just see a cover sheet with a name and go into reading those questions, the answers to those questions with a name in mind, to have to discover it in the course of reading the real meat, the content of the answers to the questions, I think was a really important way to focus on the substantive part of the applications rather than have a name going into it. So I appreciate that it's imperfect, but I also even more so really appreciate that it's a step in the right direction. And in many instances with my stack of, I think, 14 applications I had to review, there was no way of knowing. There was nothing identifiable in the way they answered. And finally, I just want to say how pleased, again, at least with the stack I had to review, at the demographic diversity, particularly the number of younger applicants that we had relative to many of our committee applicants, and particularly the number of women, and across the board, the really impressive skill sets that people brought and the clear commitment to participating in the process that the applicants had. So thanks so much.
Thank you, Commissioner. Are there other commissioners? Questions, comments, discussion, guidance? Commissioner Farr.
Oh, zero guidance, Chair. But Judy, I just wanted to say this. I have absolutely zero criticism with the process that you've gone through. A superb job of managing a running horse, and bringing a very usable set of decisions to the Board of County Commissioners. I think you know, it stands out, and it's every time we talk about redistricting, I talk about the fact that people who live in the shadow of the University of Oregon live in the dorms, have the same representative as the ryegrass farmer who lives in shed. And you know, that's an example of how people have, Laura, you said affinitive community, keeping affinity communities whole. That's an example of not doing that. You know, we're avoiding things like that. I've been a part of 2 redistrictings with the city, and the first time was a heavy lift, which went very smoothly. The second time was a lighter adjustment, which also went very, very smoothly. And I think you're prescribing a process that really can be scrutinized by anybody watching, and it's going to be an interesting process as we move forward. Once again, Judy, I want to I'm looking right in your eyes because I get a chance to do it right now. And a good job bringing this process forward. Thank you.
Thank you, Commissioner.
Thank you.
Any other commissioners? Commissioner Bozovich.
So I guess first I want to say, Judy, those are great glasses. I haven't seen those yet. So
I saw Commissioner Bozovich smile, Judy, as you came on. I thought that was what he was.
Yeah, but I just have a quick question. You know, I got my 11 applications, and I provided you my choice. Do we need to make that choice, you know, public as the board right now, and somehow or another as the board move to approve those choices, or, you know, what's the clear step now? I picked somebody that, you know, unincorporated area near Florence, so voice from the coast, and a female and a mother. So, which is my application number 11. I'll make that public right now. Is that what you need, is for each one of us to identify our choice at this time?
Chair Bernie, Commissioner Bozovich, I can take that one. I've actually had inquiries from 3 or 4 different people. And what I indicated to them was it was my belief that the board was going to, at some point during this board meeting today, announce who their applicants were. That was the goal. And so that there was no specific place for that. It could happen here. It could happen at the end of the meeting, and then we would notify folks. But that's basically what I kind of deduced was the process based on all the conversations.
Well, I think I've just led off with making my choice public.
Thank you, Commissioner. And Mr. Dingle, I would like to say that I've been in touch with Ms. Williams, and because of schedule things that have been a bit crazy, I'll be providing her that choice after the board meeting, probably into the evening. So I cannot, I apologize, oblige by your comment to that person. And I apologize to the board for that too, but I'll get there. I'm still looking at them. Are there any other board comments at this time? Commissioner Buck.
I'll just say that I really appreciate everybody that applied. At first, when we knew that a week ahead there was only 6 people, I got really concerned. But we have plenty of choices. I have 9 different choices in my region, and it is really hard to decide because a lot of people have some really good answers to the questions we provided. I'll also get you my choice before the end of the day. Sometimes it's just hard because there's so many good people that really do want to participate, and I have high hopes because of that with our committee.
Thank you, Commissioner. Did I see any other? Yes, I thought so. Commissioner Trieger.
Thank you, Chair. I just wanted to mention, because as Commissioner Farr stated, it's really important to think, communities of interest, and with redistricting, we especially are more inclined to think of geographic communities of interest. But and this is more just a general comment for the public watching, because I'm sure you'll dig into this with the IRC. But understanding what it means to be a community of interest is not just limited to a particular neighborhood or geography or proximity to a natural, to a landmark or something. It's really about certain groups, particularly groups protected under Voting Rights Act, certain racial and ethnic minority groups. LGBTQ people are not actually directly protected, for example, by the Voting Rights Act, but are certainly a community of interest. Government decisions impact them. Many recent discrimination attempts have, through public policy, that community is very much under attack. So the idea of understanding what is a community of interest goes in addition to and well beyond geographic boundaries. And so I'm hoping that whatever kind of training and conversations can happen with the IRC once it's fully seated can include a conversation and understanding of that.
Thank you, Commissioner. Since we've obviously begun our second round of questions and comments, are there any other commissioners that would like to speak? Judy, my questions are half because I'm dumb, and the other half to make sure this is public information. So as I look at the time frame, here's the question. Everyone's going to laugh at me. if in fact redistricting changes any district boundaries currently in effect, is this impacting the May primary? For anyone listening but not watching, multiple heads went up and down, which means yes. So how does that work if the applications for filing are in September? When do they close?
Yeah, Chair Bernie, Ms. Betchart has raised this very issue. They're dealing with it on the state level. The answer is they're just kind of rolling with the punches at this point, but that is why she wants to get this done, is because it is theoretically possible that you could file for a position in September that wouldn't exist in.
Exactly. So that was why I asked, and forgive me for, I should know this stuff. I'm filing, but when do filings for office close?
Chair Bernie and commissioners, it's March 8th. Is the last day for the May primary election. And so again, as Steve Dingle, there's a very wide range here. And so again, the sooner the better that we can get everything in place. It will just not make the committee feel rushed, but also just trying to address those pieces so that it won't be a cobweb of trying to figure out which boundary folks are in prior to running.
Yeah, I absolutely understand the quagmire that you and we are in, but I'm still going to try and follow this through a bit. So based on the time frame, when would the committee I know it's speculative, but based on that, when would the committee make recommendations to the Board of Commissioners? And when would the Board of Commissioners then make a decision? And how early would that provide people in that scenario for filing for the correct district?
What it would be is you would have to do, presumably the ordinance that you're required to adopt would be done before that end of December date to give that's obviously, as Ms. Williams pointed out, the further we can push that up, the more time that gives Ms. Betchart to do that. I mean, I believe that 30-day period from the end of December to the end of January is not her preferred timeline. That's the minimum timeline.
Right.
So when you figure, and remember, there's the 13 days between, it's going to be a regular ordinance process. So, and again, part of it is, it sounds so speculative because we just don't know when the data is going to come to the state and when the state's going to be finished drawing their lines.
Right.
And then we're the tail there at the end of that those things have to happen before we can start our process.
Thank you, and forgive me for getting into a bit of the weeds of reverse engineering, but I think we all see how important this becomes so that everybody has an opportunity to run or file or whatever the heck they want to do. Yes, Commissioner Farr.
I'll go a little bit deeper into the weeds. I live within a few feet of Commissioner Bozovich's. Literally within a few feet of Commissioner Bozovich. So if Mr. Dingle, if I am districted out of my district in the upcoming decision making, and I'm placed in West Lane, that will give me a pretty short time to do my campaign to run for that district seat. But that being said, that's not my real question. My real question is, if a commissioner is districted out in the redistricting, do they complete their existent term, or do we begin a search to replace that commission by somebody who lives in the new district?
No, the commissioner, you've been elected, everybody here has been elected for a specific term. That term has to be completed.
Right on. Thank you.
The term has to be completed, Commissioner Farr, even though you won't be representing anything under that scenario. But your adversary, Commissioner Bozovich, would like to say something. I'm just kidding.
I just want to clarify, by our charter, we could not district somebody out that's in the middle of a term. Now, as the three of us that are coming up to the end of a term, we could be districted out, but Vice Chair Farr and Commissioner Trieger being in the middle of a term cannot be, the redistricting cannot remove them from their districts. That's set in our charter. So that's one of the constraints that the redistricting committee will have, is what our charter says. And that's very specifically spelled out in our charter.
Well, Ms. Williams and Mr. Dingle, it seems as if census data is coming in later than normal. We still are at the whims of the state in terms of when we receive data to work with. It's going to be an interesting process, and concurrent with all that, so consistent with the times, we've developed a new process that may be a very stellar kind of a process to ensure, I can't quite quote Commissioner Trieger, but I agree with what she said. You know, it's hands off, but it's still very, very, you know, it's trying to give all the voters as much representation as properly and appropriately as possible. So here we go. And thank you so much. Are there any other questions regarding the process? I know we will be checked in with in the very near future. Thank you.
Thank you all.
I believe there is no executive session today.
No, there.
I'm sorry. Go ahead, Mr. Dingle.
That's what I was going to head you. There actually are two executive sessions. We have a very, and you can see Mr. Tappy is in my office. We have there's a brief legislative update, or not legislative, litigation update, and then there is I believe there's another executive session with one of our bargaining units. So it's your pleasure. I estimate that you've received the materials in the last couple of times since we adjusted the format. These have been very brief, from 10 to 15 minutes, so I'd leave it to the board, to the chair's pleasure in terms of whether you want to go ahead and do the litigation update now. It would probably go a few minutes into the lunch hour, but then you wouldn't have to do it in the afternoon, but it's up to you all, whichever way you want to go with the board's desire is.
Well, I'll tell you what, let's take that up. I missed item 10C, and I apologize, and that's county administration announcements. Mr. Mokraheisky, and then we'll get back, Mr. Ding.
Thank you, Chair. Just a couple things I want to share with the board. You did receive an email from our Lane County Emergency Manager, Patience Winningham Melcher, here a little bit earlier this morning as a brief update, and I'll just provide a few comments and then share with the board. We discussed this with the agenda team, the chair and vice chair, this morning. We will be providing, I believe we're scheduling bi-monthly, so every other week, fire updates. So you'll continue to receive the COVID-19 update and the holiday farm fire update. We're also going to stagger with every other week from the COVID-19 update, a general fire update, as we're in fire season. We do have some fires burning. So if we don't need that time, we can always cancel it or not use it, but we think that there will be information. Just a brief update on that, and resources to connect folks to the INSA web site. So that is www.incweb.nwcg.gov. I know that's a tough one, but it's incweb.nwcg.gov is the site that you can find all of the information about the Middle Fork complex. And just briefly, I'll share that the week of July 26th, lightning caused 22 wildfires in the Middle Fork Ranger District on the Willamette National Forest. For fire management purposes, the various incidents have been officially named the Middle Fork Complex. So we're sort of treating this as a number of individual, but a group of fires that are being coordinated together. The fires range in size from less than an acre to 300 plus acres. The incidents are in the Fall Creek, Hills Creek Reservoir, and north of Huckleberry areas. 2 incidents are close to private lands and are priorities for the forest, along with safety of firefighters and the community. So more information, again, can be found on the Middle Fork Complex fires at that INSA website. There's also on Facebook. If you search on Facebook, Middle Fork Complex, there's a Facebook page that you can follow as well on the Middle Fork Complex. So I may not be the best source of detailed information on that. If you have questions, certainly ask those. But again, we'll provide every other week updates. The other update I wanted to provide, and I'm just going to try to find this really quick, is land management. And so this has been a question I know, and I just want to provide you a little bit of an update. I meet monthly with our land management team, Keir Miller, our land management division manager, Amber Bell, our planning director, and Lindsay Eichner, along with Dan Hurley, our public works director. And I met yesterday with our team from land management. I just want to share this. I'll forward this email to commissioners. But we, just for context, is we now have, as of June 1st, our staff at the Customer Service Center at the Delta Customer Service Center has been in person, and we're providing, and we're able to provide better service to our customers in person there. Also want to share that one of the things we've been challenged with over the course of the past year is that we've had 25 vacant positions in land management. So I just want to give you a bit of an update on that. 25 vacant positions over the past year. 10 of those 25 are new positions that we created, that the board created in response to Holiday Farm Fire and the increased work level there. 9 of those 25 were created by internal promotions, which is a good thing. People internally moved into other positions, and then it created these vacancies that we needed to fill. And then 6 of the 25 were the result of staff either leaving for other positions outside the organization or retiring. So of those 25, we've now filled 15 of those positions. Additionally, candidates have been selected for an additional 6 of the positions, and will be on board in the next few weeks. So that's 21 of the 25 have either been filled or will start in those new positions. And then interviews are in process for 3 of those positions, and the final one vacancy has been posted and closes on August 16th. So I'll send that update to you. I just wanted to provide that context. I've heard from commissioners about, and from members of the community, frustrations about the challenges and timeliness of all that. We're hearing more and more feedback from folks in the Holiday Farm Fire area and in the processing with the various legislation that's been passed by the legislature, the expediting of permits in the fire area. That's gone over very well. We've been able to really timely process permits in that area. Now there's a little bit of frustration from other folks that are outside the fire area that are wanting. So we're working through that process, and our team in land management is really committed to continuing to invest in those improvements, and staffing up for those positions is a critical part of that. So work that continues, and I'll provide future updates for you there. That's it, unless you have questions for me.
I see no questions, Mr. Mokrahajski, and Mr. Dingle is no longer with us, but I wanted to share that Ms. Jones reminded me that at least one commissioner has a noon obligation, and we already have an executive session scheduled for this afternoon to deal with that. So is there, I'm now at item 12, our last item this morning. Is there other business from commissioners or staff? Seeing none, we will take a recess and reconvene at 1:30. Thank you all so much for, hey, 11:59, we did it. Thank you very much. See you in the afternoon. Bye-bye.